We are waiting for a quorum. Yeah, sound check, hello. Good morning, we are waiting for a quorum. That's why we are delayed. So we're waiting for a couple of our colleagues to get off of 97. They are making their way here. Thanks.
this in. All right, well, I think we are going to get started. We can start without a quorum. We need quorum to make any formal decisions, so we know a number of members are on their way, still stuck on 97, so thank you everybody for your patience. And I think we are going to begin. Just welcome. We'll turn it over to Auditor Tannen and his team. Thank you for being here.
Thank you. Let me start off by saying, can you hear me? For the record, I'm Brian Tannen, your legislative auditor. With me on my right is Eddie Rubenstein, who was the director responsible for the regulatory services audit. It takes an army to put together an audit, this one in particular, and so behind me I have members of the audit team that I'd like to introduce, some of which could not be here today. Rob Smith, Heather Warner, Brendan Coffey, Nate Suffin, Edward Kendall, Jamie Brown, Kareem Jackson, Raj Sharma, Charlie Price, and our data analytics team, which contributed to a lot of the information that's into this report. We would not be presenting these findings here today without the members, all the members of the team. We're here today to present the MDH Regulatory Services Report. It's a single report, but it really is 23 different audits because of the way these individual boards are structured. And when you look at the findings, I think there's, how many findings in the report? 9 findings in the report. It's really 9 findings times the number of boards. So for any one of these findings, let's say cash receipts, we didn't look at cash receipts once, we looked at cash receipts 22 different times or 23 different times, which made it very challenging. And as challenging as it was for us, it's equally challenging for the individual boards to go and implement the controls that we have included in this report. And it's a monumental moment because for 2 of these findings, we just celebrated the platinum anniversary, or are about to celebrate the platinum anniversary of those findings. That's, 20 years. I had to look it up. Don't tell my wife. But 20 years is a long time, and it's challenging. And some of those findings kind of, over the years, have changed. One board implements it, another one doesn't, and it becomes challenging because each one of them are sort of responsible for setting up their own controls in each of the areas that are included in this report. Sometimes they get together through an MOU to go and address some of the controls or some of the processes, but overall, there is no one single person to point to establish accountability over the findings in the report, which is both challenging on our end and, more importantly, for the department in implementing the recommendations. With that, I'll turn it over to Eddie to walk through the findings in the report.
Good morning. Can everyone hear me? My name is Eddie Rubenstein. As Brian said, I'm the director that was responsible for the audit. Starting on slide 2, it gives an overview of the report. As Brian said, regulatory services consists of 22 health professional boards and commissions and the Office of Healthcare Quality. Collectively, they're responsible for licensing and regulating health professionals such as physicians, nurses, pharmacists, and health facilities around the state. Slide 3 gives an overview of the key findings, and I'll start with finding 1 on slide 4. In January 2023, the U.S. Attorney's Office announced that an investigation had identified a scheme where numerous individuals used fraudulent credentials to qualify for the National Nursing Board exam. These individuals were then able to obtain nursing licenses in various states, including Maryland. As of February 2024, the Board of Nursing could not document that it had investigated 259 of the 287 individuals that were suspected of participating in the scheme. Based on state records, as of December, at least 131 of the 259 individuals were employed by a Maryland medical facility, including 6 individuals who were employed by a state-owned facility. Next slide, slide 5 is finding 2. The HPBCs did not ensure that the investigations against licensees were completed timely. MDH has developed timeframes that range from 6 to 18 months for the boards to complete investigations and determine whether to bring charges with the Office of the Attorney General. As shown in the table on the slide, as of February 2024, 3,600 of the 4,900 open complaints were past MDH's timeframe, including 3,000 complaints that have been open for more than 2 years. For example, a complaint related to alleged sexual abuse received by the Board of Nursing in December 2021 had not been investigated as of February 2024. Timely resolution of these complaints is critical since licensed individuals are authorized to practice until the investigations are completed. The HPBCs generally attributed the untimely investigations to staffing shortages and uncooperative licensees. However, our review of two boards, the Board of Nursing and the Board of Professional Counselors and Therapists, disclosed certain deficiencies that may have contributed to the failure to investigate these timely. For example, 443 open complaints received by the Board of Nursing between July 21 and October 23 were not recorded on the Board of Nursing's complaint tracking log. The next finding on slide 6 is that the Office of Healthcare Quality did not conduct annual inspections of certain assisted living facilities, developmental disability services providers, and long-term care facilities as required by state law. These inspections are critical to ensure compliance with state and federal regulations regarding patient care and safety, and inspections that are conducted frequently disclose conditions that require corrective action. We found that OHCQ did not complete a significant number of inspections each year. For example, there were 1,721 assisted living facilities that required an inspection in fiscal year 2023. OHCQ only inspected 444 of them. That's 26%. There were 365 developmental disabilities providers. Only 170 of them were inspected. That's 47%. And there were 225 long-term care facilities. OHCQ only inspected 42 of them, which is 19%. I would also point out that this finding dates back to 2004 in our various MDH reports. And although OHCQ has initiated a plan back in July of 2018 that was aimed at increasing the number of inspectors, we noted that increase did not result in OHCQ meeting the statutory requirements. And if you're to compare their year-over-year performance in the table in our report, it actually goes down in the more recent years. Next is slide 7, the cash receipts, finding 4. We found that controls over collections received at certain boards were not adequate, and duties related to cash receipts and licensing were not properly segregated. In total, we found deficiencies at 7 boards. For example, we found that seven of the boards did not conduct comprehensive reconciliations of licenses to the related collections. We found that the Board of Dental Examiners and the Board of Professional Counselors could not support $1,600 in fees associated with 4 licenses had been received and deposited. We also found that the value of licenses issued by the Board of Pharmacy exceeded the amount deposited by about $46,000. The last finding I want to talk about is finding 5 on slide 8. We found that 6 HPBCs did not require criminal background checks to obtain a license, and 10 boards did not obtain subsequent alerts of criminal activity by licensees. State laws and regulations provide that each board may deny a license if the applicant or licensee is convicted of or pleads guilty to a crime involving moral turpitude. However, state law only requires criminal background checks and subsequent alerts for certain HPBCs. Specifically, for 6 HPBCs, pharmacy, dental examiners, dietetic practice, acupuncture, optometry, and environmental health specialists, the state law does not include a criminal background check provision. Similarly, state law does not include a provision requiring subsequent alerts for 10 HPBCs. The 6 I just mentioned, along with the boards of physical therapy, psychologists, morticians and funeral directors, and podiatrists. We performed a match between individuals licensed by the Board of Dental Examiners and Board of Pharmacy as of February 2024 to conviction records obtained from DPSCS. We found 16 licensed dental professionals and 14 licensed pharmacy professionals who'd been convicted of a crime. For example, 2 dental professionals were convicted of assault, which should have resulted in their licenses being suspended for at least 1 year. Findings 6 through 9 are cybersecurity related and will be discussed during the closed session. Our conclusions are on slide 10. We'd be happy to answer any questions from the committee.
Brian?
I apologize. Before we turn over to questions, I'd be remiss if I didn't acknowledge the department's responses, which, contrary to the prior hearing, are very much detailed. They agreed with many of the findings, and although there were some issues that we may have to follow up with them, overall, they were agreeable with the findings in the report.
Brian, thank you for the presentation, and thank you to your whole team as always. Just had a question. I know there's a lot of issues, obviously, with sort of the authority and where the authority vests in the individual boards, and I know we're going to cover that with the department. But I am just concerned, and I know it's been an ongoing issue for my county on the status checks and the evaluations and inspections of facilities. So I know there was a piece of legislation that was passed earlier this year that required, I think, quarterly data reports. Do you have any updates? Obviously, this is a little bit looking back, but do you have any updates or sense of how things have improved?
We don't, but I do believe the department's presentation provides some updates on the status of those inspections now, and I got a chance to glimpse at it, and I do think they're showing some improvement in that area. I'll save that for the department to present.
Great, thank you.
Thank you both for making your presentations, and I wanted to follow up on that because that was my line of questioning as well. I do recall somewhere in the report that you said that there did not seem to be a positive relationship between an increase in staffing for OHCQ, for example, and the number of inspections that were completed, and which is contrary to the report that I think we will hear from the department about OHCQ specifically. But I just wonder if in the past you have gotten whether this time seems any different. Obviously, we will hear from them and the progress they have made, but has there been similar reports of progress in the past that have not borne out in this report in terms of catching up? Can you speak to that?
So again, I think they should be able to provide some better perspective on that. I know, or I do want to point out that the figures we're given in our report are through fiscal 2023. So obviously there's been, more since then. But going back to the prior report, they had started implementing that staffing plan, and yeah, if you just compare the last 7 or 8 years, we don't see that positive correlation between staffing and the percentages that they're completing.
More importantly, if you look at the trend, if you compare 23 to 20, you'll see that it's almost 50% of the audits that were being done in 20 are being done in 23. And sometimes, things do go up and down. But I think the fact that they increased in 2001 and then started coming back down is a little bit concerning as far as whether or not there are systems in place to make sure that they are going to accomplish the required inspections long term, which is, I think, what everyone on the committee is looking for. But again, I think the department would be better served to respond to what they put in place.
Thank you. One other question, slightly different topic, but and this is probably a question that we will also ask of, or at least I will also ask of the department, but you have, I think, had some chance to get a sense of a potential consolidation of, for example, inspections, or kind of, since there are so many different boards here, that there is the potential for efficiencies, perhaps, among and between the different boards, and that may be done in other states. And I just wondered if you wanted to comment on that.
So I can't comment on other states. I think maybe the department may be able to, but I can say that we could look within the state. And the model that the Department of Labor has for their occupational and professional licensing boards is different than the model that we have here. And I think you'll see that bear out in the report that we recently issued on theirs. They don't have a lot of the same conditions that we have now. Segregation of duties, establishing controls, it's not easy. It's hard to do it once. It's even harder to do it 23 times. And so I think there's an opportunity, if you need one person to process collections and you only have a staff at 5 at a board, it's going to become very difficult to identify segregation of duties and have someone who is effective when that one person decides to do something crazy like take the day off or go on a vacation. When you consolidate that, you can have multiple levels of people there, so you have a little bit of redundancy, and you set up a process where people, that's their full-time job, is doing these things, and it lends itself to better controls in the long term. Yes, there are nuances with each board, but I think that at least someone needs to take a step back and look to see whether or not that would be an effective change to address some of these long-term issues.
And could you identify some of those areas? I mean, IT perhaps, hiring personnel.
Correct. Definitely cash receipts, the licensing. I don't want to speak to the IT controls. We'll talk about those later, but perhaps in those areas as well. But just within the findings here and now, following up on complaints, the question is, could that be an area where we take a step back and say, if we had one unit, it's not just about doing the follow-up. I want to be clear. It's the process in place to monitor the follow-up, to make sure they're being done timely. And so each unit may be able to do that, but if we had one entity responsible for setting up the control to make sure those processes were working effectively, I think that's where we could see some positive change to some of the findings in the report.
Thank you very much. I'll turn it over to colleagues.
I think Delegate Arentz, I saw you up first. Go ahead.
Thank you. Appreciate you being here, appreciate your findings. I think it'll be interesting to hear some of the answers to these questions. But I guess I wonder, you have repeat findings in here, and we've talked about this in the past about this. Are there any mechanisms that we can put in place, that you all could put in place, that when you have a finding, that there's somebody actually checking up to see that finding to be addressed moving forward?
So I do think the health department is here, and they have an inspector general and an audit unit that does follow up on the audit responses. They're in the audience, and perhaps they could address your specific questions about what they do related to these findings. I do believe they have done some follow-up related to that, but it's challenging. Again, like I said, you're not following up on one, in this particular audit, you're not following up on one, you'd be following up on 23.
Well, I get that, but that leads me back to the actual boards themselves. I mean, if you're all similar and you're bunching them into one board, essentially, you're saying everybody's included in this, there is no mechanism to have them actually communicate with each other and become unified in the sense that they're actually doing the checks and balances that they need to do. And then I guess the next question would be, are we hoping to get a process in place for these boards? And why is it that we have to put that process? These are business units that have been going on for decades. And it seems to me we come in here and we continually try to make an excuse to reinvent the wheel. These have been operating, as I said, and now all of a sudden for the last 8 years, I assume, we're finding these problems coming back or reoccurring. Who's not following up on this? Is it staff? Is it the board itself?
I think some of it is could be challenges if, because the boards historically and maybe even statutorily have some level of independence, you're leaving these decisions to a very small group of people, and it becomes challenging to identify the right people to go and do the job and to maintain that level of control. And that's one of the challenges of having each one of them with their own licensing system or with their own process to process cash receipts. I think that's where if you had a consolidation, which would be thinking a little bit out of the box as it relates to these boards, we may be able to see some consistency, and we may be able to put a singular monitoring process in place to go and stay on top of them on a regular basis so they're not waiting for an audit, that they know regularly whether or not these things are in place and are continuing to stay in place during the course of the interim between audits.
So are you saying that these background checks that were not being performed, that's something everybody does differently?
The background checks, as Eddie pointed out, each board had its own process, had its own requirements for which background checks needed to do. There was not one unified requirement for each one of the boards to go and do a criminal background check.
So we're dealing with mental health issues and people, and in general, taxpayer people's in need, and we don't have an across-the-board policy that says everyone that comes in here that interacts with these people needs to have a criminal check. That's not there across the board.
It's not, the requirement was not consistently across the board.
And last question, I guess, we've been doing this a long time. What has changed to make this so egregious now? Or is this forever?
I would tell you, three of the I don't want to quote it right, I believe it's 3 of the 7 non-cyber findings are repeats, like I said in my opening remarks, that go back almost 20 years. So there is nothing new. It's the same thing, and it just keeps shifting. It just becomes, it's unfortunate because it's not just programmatic, it's not just financial, it's also programmatic, the inspections, the follow-up on complaints.
It goes back to my constant complaint. There is zero accountability in all this process if it's happening this long and we're not fixing it. We're wasting a lot of taxpayer dollars. We're not servicing the public that we're hoping to serve with the people we need to serve them. Wouldn't you agree? I'm done.
I'd agree that there's some room here for both efficiency and a more effective process, if we at least consider it. I don't know, I do, you could ask my team. I am very good at coming up with ideas. Many of them are not good. But when you have a situation, we can't control the circumstance, we control the way we address it. And I can just tell you, in 20 years, the current process has not been effective to address at least the 3 issues that were, the two of the findings here across the boards. It's worth a shot to try something different, especially when we can point to another agency with the exact same circumstance that they have and it's successful.
I would agree with you that it's not successful, but what I question the most out of, why has this gone on for 20 years and we've not been able to fix something that is a problem over 20-some years? Is that our fault? Or is that something we're not doing as the legislature? Do we have to sit back and walk step by step? Or is this something these boards should be responsible for?
I think it's a mix. I could tell you the legislature has been aware. We've testified about some of these findings at previous JEC hearings. Clearly, it's been in our report over the past 20 years. But I think there is room for, like some of the things with the criminal background checks, there's potential room for some statutory changes to make sure it's more comprehensive to address the boards that we see didn't have the requirements.
All right, thank you. Thank you, Mr. Chair.
Senator Lamb?
Thank you. I think Senator Hedelman started on the point that I was going to make, which is, and I wanted to dive a little bit more deeply into it. The 23, it's really 22 health occupations boards plus OHCQ, almost function in there as like mini agencies on their own, right? They have a special line of funding because they're specially appropriated. They have their own staff. They're kind of semi-autonomous within there, and they're not directly reporting necessarily back to the secretary, except for the Board of Physicians, which is structured a little bit differently, and they're not actually the ones that are having the problems that we're seeing up here. The Board of Physicians generally seems to be doing okay. But in the process of having, 22 other health occupations boards all functioning on their own, there, as you point out, a lot of duplicative services that are just kind of redundant in this process. A, probably not being the most efficient, and B, leaving a lot of gaps in how different processes and systems are, put together. I know that there's been, and those of us who followed the health occupations boards for many years have known that a lot of these boards are broken for a variety of reasons. Some of them because of, these outstanding complaints that haven't been reviewed, some because licenses have been held up for long periods of time before they're finally approved, and a variety of other reasons. I guess to your point, which is that we may not have the best structure here for these health occupations boards. I think we all have a part to play, right? There's some statutory changes that can and potentially should be made. I know the prior secretary had also told us that she was looking at kind of a top-down review of how these health occupations boards were structured, potentially to make them more akin to the Board of Physicians type, where it is a reporting back to the department and back to the secretary. And then, with the health occupations boards, I think at least some of them, we know from these hearings, have been mismanaged. I think there have been some, cause for concern within some of these health occupations boards, which I think we'll probably hear about a little bit later as well. Is the MDL model the best model to be able to look at, to be able to have more unified central services, to be able to allow them to maybe centralize the licensing piece and so that piece can be done under one umbrella, maybe more kind of a departmental centralized function, and then leaving it to the health occupations boards to deal with disciplinary action, where you want, if you have a dental complaint, you want dentists to be able to view that. And then also, being able to come up with policy recommendations for regulating those specific professions. Would that be a good model to kind of separate that out into?
I think each one of them has their unique specialty, and they should be focused on that specialty. And to the extent that we could remove things that are not essential for their unique specialty, I think it's going to, move that process to someone who is specialized in that area. You need an accountant to manage the accounting. You don't need a nurse. You don't need a doctor. You don't need a clinical psychologist to go and do that. You do need them to go and and perhaps take disciplinary action, things like that. So I think there's an opportunity here to look at offloading any responsibility that's not critical for them to go and focus on their primary objective, which is to regulate these different health licenses, and try to get somebody else. And then they're just focused on what their primary mission is. And I think there's a lot of gray area in between, and you could try something, and if it doesn't work, we could change it. But the answer is we should try something different to break the cycle that we've had here, at least in the areas that we're talking about. Reconciling licensees to collections, you don't need a nurse for that. Establishing, taking a look or following up. One person could be responsible for monitoring the complaint investigations. It doesn't make a difference if it's a complaint for a nurse or if it's a complaint for a physician. Each one of them has their own criteria, and it's very easy. The department, the committee could ask them to provide, quarterly reports on the status of that. You don't want to have 15 or 20 different reports. You want one report that someone could consolidate and provide those statistics to you, so we're not waiting for an audit report. You know what the status is every quarter. And I think that's one of the benefits that you could have by consolidating some of these efforts.
So I guess we're on the same page where there are some centralized functions that would be better done from a unified office or maybe within the department in some kind of other fashion than having 22 similar processes for licensees trying to apply for a position, collections, billing, all of that stuff, which is recreated within each of these health occupations boards, but then leave the boards to more board-specific functions that really require their level of expertise, which is one, kind of disciplinary action, and two, any specialty-specific policy kind of regulatory decisions.
I would agree with that.
Yeah. Okay. Last question then has to deal with kind of the funding piece, because I think most of these health occupations boards are special funded, right? So the funding that they get is coming in from licensing fees, and that is supposed to be self-sufficient for that board. I guess, because of the way that's structured, I think potentially it can, and I'm open to your opinion on this after you've looked at these, is that it can make it difficult for them to do much future planning, to have the adequate level of resources, because they're kind of limited within that budget that they have via that special fund. And even though they have a natural incentive to keep that low, because these are burdens, so to speak, that are put on to the applicants, right? So the applicants are paying a fee to potentially get a license, and so that's paying into the special fund. And then potentially, in some instances, the BRFA comes back in and takes money back out of them, right? And so is that kind of funding mechanism the best mechanism too, from a financial perspective?
I wouldn't feel comfortable answering the question, but I do think a hybrid may be a solution. So again, if they were to consolidate some of those functions, perhaps those functions wouldn't necessarily need to be specially funded, and those special funds could be directed towards the unique attributes of that board, while state general funds will be able to handle those. I think the department and probably the Deputy Secretary of Health may be in a better position to address the funding mechanisms.
So fair to look over kind of top down also the funding piece of this, because I think that, the special funding structure, I think, makes it really difficult for them to have potentially the resources they need and to be able to do future planning. But to your point, there's a lot of redundancies there to this process.
Correct.
Right. Okay, thank you.
Any other questions? Thank you. Thank you very much. And I think we'd like to call up the Department of Health, Regulatory Services.
All right, good morning, everyone. My name is Meg Sullivan, and I am currently serving as the Deputy Secretary for Public Health Services at the Maryland Department of Health. I am joined today by Director Tia Witherspoon, who is currently serving as the Director and Executive Director of the Office of Healthcare Quality. To my right is Deputy Secretary Clint Hackett, who serves as the Deputy Secretary for Operations at the Maryland Department of Health. We first are going to provide an update specific to the Office of Healthcare Quality with regards to where we are in terms of the audit findings that you just heard about regarding inspections of assisted living facilities, developmental disability service providers, and long-term care facilities. Go to the next slide. So just as a really brief overview and reminder, the Office of Healthcare Quality, or OHCQ, is the agency within the Maryland Department of Health that determines compliance with state licensure and/or federal certification requirements in 47 types of providers and programs. And as the slide highlights, there are some nuances with state licensure, which really issues the licenses and authorizes the applicant to operate a certain type of business in the state, versus federal certification, which recommends certifications to the Centers for Medicare and Medicaid Services, or CMS, that allows the facility to participate in and, importantly, seek reimbursement from the Medicare and Medicaid programs for services provided to beneficiaries. Next slide. As a brief overview, as of July 1st, 2025, OHCQ oversees 23,095 providers in 47 industries. And I think as you can see by the numbers in the graph, this number has just been increasing over the past several years, with a 21% growth rate in the total number of licensed providers over the past 5 years, including specifically a 3% increase in the number of providers between FY24 and FY25. Next slide. All right, can we go to the next slide? Great. And we did just want to provide an overview of the current staffing of surveyors by the 3 programs that we're going to focus on today. So as you can see with our long-term care facilities or nursing homes, we currently have 61 health facility surveyor nurses, which includes 12 positions added during this fiscal year. For assisted living and adult medical daycare unit, we have 31 nurse surveyors, 1 administrative office surveyor, and 1 environmental health surveyor. And then developmental disabilities, we have 25 nurse surveyors and 27 administrative officer surveyors. Next slide. I think what we wanted to show on this slide too is just the evidence of growth in staffing that we have seen in each of these 3 programs. So you can see for our long-term care, between FY23 and FY25, there was an addition of 8 health facility surveyor nurses for the start of the fiscal year, and then I just talked about the additional 12 to bring us up to that 61. You can see in assisted living, we have sequentially grown the number of surveyor nurses, as well as our administrative staff, and then on the next slide, a similar model for the developmental disability service providers. Next slide. I'm just going to spend a little bit of time talking about each of the 3 units, starting with the nursing home annual inspection backlog. And I think I can say today unequivocally that addressing the nursing home inspection backlog of annual surveys has been and continues to be a top priority for the department. You heard about the audit findings and just some additional historical context. At the end of December 2023, the department still had 172 annual full survey backlog. At the end of December 2024, we had 127, but we really are moving in the right direction. And as of yesterday, the number is actually 26 annual full surveys that are still backlogged in October, which represents more than an 83% reduction in the backlog since December of 2023. Next slide. Just want to focus on how we address this backlog, and really I know also how we are going to move forward to continue that we don't see these findings again in the future. Really have been focusing on a 4-part strategy. The first is about staffing, so both securing staffing for merit-based surveyors as well as contracted surveyors. Focusing on training to make sure that the training is efficient yet high quality, and then really looking for improved efficiencies in our program operations and our surveys, again, to be able to operate more efficiently without sacrificing quality. Next slide. So to go into just a little bit more detail, The department was able to secure staffing for contracted certified nurse surveyors, which really has given us the flexibility to train and transition our merit staff to full independence. As you may all be aware, for onboarding and training of surveyors does take time, and so to bring on contractors that are able to perform many of these inspections has allowed us to give this flexibility to really build up our merit-based staffing. In addition, we have been able to hire 33 new long-term contractor surveyors since July 1st of 2023, which you can see detailed there. We have been able to convert 10 contractual positions to merit, and we have also been able to secure an increase in salaries, which we know is very critical for recruitment and retention of these surveyors. Next slide. But recognizing that staffing is not the full answer here, we have also been very focused on enhancing our training and efficiencies to allow us to sustain this compliance. So the first thing is looking at the time of surveyor training, and we've been able to decrease it from 12 months to 7 months by really, again, making it as efficient and focused as possible. And then we have focused on efficiencies in the survey completion without sacrificing those quality and compliance standards. Next slide. And this is just a few examples of the efficiencies, which you can see from this slide, focus on enhancing technology for field-based employees, but looking at our data enhancements to leverage data from CMS, as well as some of our internal data analytic tools to be able to closely monitor survey backlogs, recognize where we need to be focused, and enhance our operational efficiency. And then streamline our survey scheduling, implementing geographic-based scheduling near surveyors' homes or clusters, again, to minimize travel time, reduce the amount of time it takes to complete a survey, and to then be able to increase them as well. Next slide. In terms of where we are right now, as you heard, as of yesterday, we had 26 surveys that we needed to complete to finish the backlog, and we have been working towards full compliance with annual full surveys by December 2025. I do want to note, though, that during the government shutdown, we have been given guidance by CMS that we need to pause annual survey inspections. We are working with them right now very closely along with other states to clarify this guidance, to stress the importance of it, and we continue to see where this guidance goes, but at least at this moment, while we still continue to work towards annual full survey compliance by December 2025, know that the government shutdown may impact this, and we will continue to keep you updated as we get further guidance from CMS. We also know that with staffing, unexpected vacancies, retirements, resignations could impact the staffing, and this is again why we are working with DBM to ensure that we have a secure and stable staffing base to the extent possible. And then we also know that in addition to annual inspections, we need to there's a CMS triage system, particularly related to high priority or immediate jeopardy complaints. So if there were to be a significant increase in those, that may impact our annual inspections. But again, I hope you see by the comprehensive approach that we've taken and the way that we've tried to approach this, again, we are making significant progress and have seen significant improvements since the audit findings. Next slide. So moving on to our assisted living facilities, just a reminder that OHCQ is responsible for the licensure and surveying of Maryland's 1,624 assisted living programs. All facilities must comply with the statute in COMAR to be licensed. This was substantially revised in April of 2025, meaning that the survey cycle target is annual per COMAR or once per calendar year, but now may be extended for facilities that demonstrate kind of extended compliance with the COMAR regulations. So in terms of our current statistics, there are, as of September 1st, 2025, there were 1,624 licensed assisted living facilities. And again, at that 1,213 facilities, or nearly 75%, that was the number as of the end of August 2025, had received an annual or initial inspection in accordance with COMAR requirements. We have been working diligently to continue to bring that number that have received the inspection up, and by the end of October 2025, the backlog will be reduced to 190 annual surveys, and we are on track to eliminate the annual survey backlog for assisted living facilities by the end of 2025. Next slide. Again, just a brief overview of some of the ways that we have been been able to show this positive improvement. So first, through increased recruitment and staffing. As of May 2025, all nurse surveyor positions for the assisted living program were fully staffed, and really working on not just staffing them, but making sure that they are trained and able to conduct surveys independently. But we have had 4 nurse surveys that have successfully completed the training, and as of about a week ago, 3 nurse surveyors remain in training, but we hope to complete that soon. We also have been working on, similar to the long-term care facility program, staff reassignments to make sure that we are optimizing our workflow, that we have dedicated surveyors dedicated to completing these annual surveys, as well as focusing on geographic efficiencies. Next slide. And then just briefly, the Developmental Disabilities Program, OHCQ conducts licensure surveys and investigates complaints to verify that community-based providers serving individuals with developmental disabilities comply with COMAR, and we serve as the licensing and monitoring agent for the Developmental Disabilities Administration. Next slide. So currently as of the start of FY26, I should say, there were 387 licensed and/or approved developmental disability providers statewide. And according to COMAR, we are required to conduct on-site licensure visit of the Developmental Disability Administration providers annually for those facilities that have active residents or participants receiving services. So typically is not 100% of those facilities that have active residents or participants receiving services, but for those that do, we are required to conduct an on-site licensure visit annually. Next slide. And as you can see, in FY25, OHCQ achieved 100% compliance in surveying the 274 developmental disabilities facilities that per COMAR were required to receive that annual inspection. And we did this, but similarly through redesigning the survey process to increase efficiencies and optimizing our staffing and operational approach. Next slide. I do want to say, and I know Director Witherspoon and I talk about this all the time, that we presented here has been really focused on numbers and how many inspections we've been completed and how we've been working to address the backlog. We know that a survey that is not high quality is not accomplishing its goal, nor helping or achieving the mission that it needs to achieve. And so really have simultaneously been focused on quality assurance for surveying through, this is just some examples, our data-driven oversight, which I briefly talked about, really incorporating feedback from providers and internal review panels to make sure that our survey protocols are clear and that our regulatory expectations are known and that our surveys are really addressing that. We are conducting audits to ensure that our surveys are consistent and identify any variation of citation patterns that need to be addressed and ensure, again, that we're uniformly enforcing our COMAR and federal standards. We work towards targeted training and mentorship, but for both new and existing surveyors to maintain surveyor quality, and really have been focused on continuous process improvement, again, to make sure that we're not just addressing backlog and meeting our requirements, but also providing high quality surveys. Next slide. And then just last, want to say, and I heard some of the questions earlier about how are we going to make sure that we can continue this progress and don't see those audit findings again. And I think we are well aware, OHCQ is a very large, vast portfolio that is tough. I've had the opportunity to go out and meet directly with the staff. I heard from them their commitment to the mission, their dedication, but also they recognize some of those challenges. And I think we are keeping those challenges in mind as we continue to work to meet all of our requirements. I already talked about workforce retention and recruitment. This continues to be a top priority for us, and we are working closely with DBM to ensure we have the staff that we need. I talked a little bit about provider growth. We've seen the increase that has happened over the past few years. We anticipate that may continue to increase, which results in greater survey volume and complexity, and we need to have the systems in place to keep up. Talked about state mandates versus federal mandates, navigating timelines and funding constraints, and the state COMAR requirements, federal CMS expectations, including just right now the federal shutdown and some of those complexities that we're seeing. We need to continue to work towards technology modernization and expanding our digital tools, but recognizing that data security is a big challenge and something we need to really focus on, as well as compatibility with CMS with changing federal landscape. And then finally, really just working on providing our our provider, sorry, I'm missing my notes, our provider compliance and readiness. We know that across the state, there is variability with provider types, such as the small and rural providers, and we need to make sure that we have uniformity in our survey approach while also recognizing some of the differences and different challenges that some of our providers face and making sure that we're working with them. So, we are here to answer questions you may have. I think I will just end, though. I have been in this role for 2 months. I knew from day one, in fact, before day one, that this is an incredible top priority for the department. I have worked incredibly closely with Director Witherspoon, with her staff, with the entire MDH leadership to make sure that we are heading in a right direction and that we have the tools in place to continue to do that. And I look forward to answering any questions you may have.
Deputy Secretary, thank you for the presentation, and thank you for the numbers. I think it's very positive. It's nice to hear the good report. I did just want to ask, and I represent Montgomery County, and I know, frankly, I think there was a lot of frustration for a long time that a system with the MOU with the county that had worked really, really, really well was stopped and took, frankly, I think way too long to restart. It sounds like we're in a really good position, and so I appreciate, since you've been here, the sort of new working relationship with our county and making sure that this is a top priority. I did just want to ask, I mean, do you feel like, so I know you've talked about the contract that you've signed, how do we ensure that these numbers continue to improve and that you get what you need so that not just in Montgomery County, but across the state, once we fix the backlog, we're not looking at a system that we can't sustain?
Yeah, I think first that's a question, right, we are asking ourselves every day. So obviously, I think we are very thankful for the contracting staff and the role that they have played in allowing these numbers to go where they need to go. But hopefully the presentation made clear that, we recognize, right, that at that moment that is time limited. So first it is onboarding and increasing our merit-based surveyors, but also looking at that efficiencies so that it is not just about increasing the number of staff, but that they are able to operate in an efficient manner. I think it's something that we have to continue to monitor, though. We are, with our very, very, very close monitoring, anytime we see ourselves going in the wrong direction, we need to take immediate action and not allow it to happen.
Great. And I did just want to ask, because I think many of us were kind of horrified by what you said. Can you clarify, so CMS has told you, because of the shutdown, or to given states guidance, that you're not supposed to be doing these anymore?
Well, not at this moment. So and Director Witherspoon can speak more directly to it. We are still allowed to there are specific activities that are accepted. An example is immediate jeopardy or non-IJ high complaints, for example. There are specific, assisted living inspections, which are state funded and looking at state licensure we can, but they have said very clearly annual inspections for nursing homes or long-term care facilities at this moment. We've had many conversations, and by we, I mean Maryland, but also many other states, and this continues to be an evolving situation. But if you want to add anything.
Thank you, Dr. Sullivan. Yeah, I would just add that while our annual surveys are paused, we are still continuing to make our presence known in these facilities by going in on complaint surveys. So if we have a complaint survey for any of these facilities, our team is ready and mobile and going into these facilities.
From your experience, has that been typical in previous shutdowns, this guidance?
Active question. I think that particularly from the funding piece, my understanding is this has happened in other shutdowns as well. I think we are looking at some of these nuances and seeing what their ability is, but there has been similar guidance in other shutdowns.
Great, thank you very much. And I think we have an extensive list of questions. Looks like Senator Reedy.
Thank you very much, Mr. Chair. Thank you for the presentation, and been looking through it, and we've spent a lot of time in the Finance Committee talking about actually Montgomery County in particular with one of my Senate colleagues on the committee, but also just trying to figure out how to get the backlog cleared. Can I ask, just so I'm clear, you do regular inspections. You also, if someone has a complaint, if I call you with a complaint, like not Senator Reedy, but anybody, and says, hey, this is going on in this particular nursing home, how fast can you get somebody to go inspect? Like, what's that process look like right now? And is it better than it was a year ago? The same? Yep.
Yeah, I'm going to defer to Director Witherspoon for that.
Yeah, thank you. So right now, how the process works is if you call in with a complaint, we have to follow a triage process. right? So if there is immediate harm or potentially immediate harm to a resident, those are our top priority. We're going into those facilities within 2 days to 3 days into those facilities to investigate those. Lower priorities are triaged at a lower level, so it could take us a little longer to get into those complaints, to investigate those complaints, but all of them will be investigated.
When you say lower priority, and I understand what you mean, if the question is, it seems like the air conditioning's not working, they're not air conditioning the place very well, but versus like, oh, people look like they're hungry and look emaciated. So there's different levels. I guess air conditioning heat could also be an emergency, but so that's what you're talking about. So if someone's questioning whether the processes are all being followed appropriately in a nursing home versus actual physical harm, is that generally how it breaks down?
Yeah, that would be accurate. So if we are talking about medication mismanagement or a very serious issue to a resident, that's something that we're going to go in very quickly to see and investigate. Unfortunately, if you're talking about food may be cold or things like that, sometimes we do have to prioritize those a little bit lower on the triage level, but we will in fact go out and investigate those.
Okay, and thank you. And I have just one more question. If there is a situation where, what happens if you get a call from someone complaining about a place and that place ends up having a licensing issue where they haven't been licensed or their license is expired or there's some sort of issue? Is that your agency that then takes that on, or do you report that to, I'm guessing, the Attorney General, or how does that process work if it's a complaint and then it turns out that you look that up and say, well, wait, you have the ability to look up and say, well, that's not even a licensed provider. Okay, does that happen, and can you do that?
Unfortunately, it does happen. So we have had that on the assisted living side, where we will have complaints about a facility and we will look it up and we will say we won't see a license for this facility. We do still send out an inspector to go and see what's going on at this residence. Are there residents there? Do they have patients in the building? Is it a hazard around the facility itself? So we are going out and looking at those things. If we need to engage law enforcement or the AG's office, we do that as well. So we have a relationship with them where we are doing those things as well.
And you don't get a notification if a license expires at a facility and then proactively go out and look at that. That's not how,
So
I'm not necessarily saying you should, I'm just curious, do you do that, or?
So right now in the state of Maryland, we have non-expiring licenses for our facilities.
Right,
So what
okay.
we would do is when we would go out on a complaint, or if we go out on an annual survey, or if we're going out to that facility, we would check licensure at that point. So we're doing it periodically throughout the life of the license. But we
Right,
do
because
have
it doesn't
non-expiring
expire.
license in
Gotcha.
the state of Maryland.
Gotcha. Okay, no, that's right. Thank you very much.
Thank you. Before we go on, I just want to remind everyone that we have a long agenda ahead of us. So if people could be as succinct as possible, it would be appreciated. Senator Hester.
I hope that wasn't directly aimed at me.
Not at anyone, all of us, all of us.
Great. Well, it won't surprise anybody that I have a question on IT modernization. Secretary Herrera Scott and I, former secretary, started having long conversations about IT modernization in 2022, at which point she said she was comparing all of the boards and what they were doing here compared to what they were doing in Virginia. And I'd asked her every year since then whether or not legislation was required to give her the power to oversee the IT, which would do two things. One, it would cut costs. Two, it would ensure consistency. And three things, it would probably increase the cybersecurity posture of the state. And I'm not asking about cybersecurity, so we'll talk about that later. But my question is, I never got an update on where she was before she left. So where are you all with IT consolidation of the boards? Because I think given the comments that the Senator Lamb was saying earlier about taking off the boards the ownership for these things that are not directly responsible for their profession makes a whole lot of sense. So can you give an update either now or offline?
Thank you for that question, Senator Hester. Again, for the record, I'm Clint Hackett, the Deputy Secretary for the Operations Team at MDH. The IT and Data Office does fall under my portfolio. Where we are right now is our focus is on the new enterprise licensing and regulatory management system that we are trying to implement for the Board of Nursing. Our concept with that is that, and I was listening very intently to some of the comments that were made this morning, it is our goal ultimately to have that be the IT system that supports licensure for all of the boards. So we are starting with the Board of Nursing. There has been interest reflected from the Board of Physical Therapy and the dental board. So we are working with the Board of Nursing. We actually have the Board of Physical Therapy at the table, observing all of the processes that we're going to be doing as we build that out. And the intent is to basically socialize that with the other boards, because we agree with you. We think it makes sense for us having one licensure system. So when we're doing an audit, we're looking into one space. I believe that we have, at this point, a vendor in place. What we did is we looked at a number of states to see how they were doing their licensure. And we liked the model. I will say that I came from the state of Wisconsin, so we ultimately kind of looked at what they're doing for their licensure. They have a little bit different model from the state of Maryland. They have a department called the Department of Safety and Professional Services that handles licensure for 90% of their license types. So they ultimately have one licensing system that supports the licensure and complaints for all of those license types. So where we're trying to head is going into that direction where we have this one system that all of the boards can adopt. So we're intently focusing on trying to ensure we have a really successful go-live for the Board of Nursing, and then we're going to ultimately reach out to the other boards and encourage them to join that platform. I believe there'll be not only improvements in cybersecurity, which I know is near and dear to you, but I think there'll be cost savings that can be realized from that type of an approach.
But just to drill down, and then, Madam Chair, this is my last question. I've heard you said encouraging. So you've got a good proof of concept with the Board of Nursing, I'm sure, and you're encouraging the other 22 boards to join. But you feel it would improve our cost effectiveness and cybersecurity if they all did. And so does the Secretary currently have the power to mandate that they all join this licensure system?
I don't believe the Secretary currently has that power.
Okay.
I am hopeful that, and I guess maybe I'm a little bit, overly optimistic, but I'm hoping that if the other boards see the effectiveness.
Yeah, you've answered my question. Thank you.
Yes, thank you.
Delegate Ahrens, go ahead.
Thank you. Thank you for being here. I loved most of your answers. They were great. How long has this process been in effect that you've come through to correct all these issues?
I mean, I think, I guess if you're talking about, right, we looked at it three prongs. So first, staffing, and I know Director Witherspoon can get more into it, but it's been a focus over the past several years, but something that we've been looking at. With the efficiencies and training, I would say it's something that has started a while ago. The one thing I would really stress, and then we'll turn to Director Witherspoon about the prior, is that it still isn't right. We are still continuing to do it and modify it and make sure that we're strengthening it going forward so that we don't find ourselves in this position. But do you want to speak more directly?
Yeah, thank you, Dr. Sullivan. We have made, I would say we've made tremendous progress on reducing the backlogs, and we've done this by, as we mentioned, bringing on those contractors, which came on, I think it was last year or the year before these contractors have come on. And this is giving us the opportunity to really work with our staff to get them trained and up and running, the 33 staff that we've brought on since fiscal year 2023. This has given us an opportunity to not only catch up on the backlog, but also train our staff at the same time. And we believe this is going to be instrumental in us staying current on our mandates that we have to do.
Okay. I guess this audit then is kind of outdated by what you've done. Is that what you're saying? So some of these things have already been corrected. We probably should be hearing.
Yes.
I wanted to ask one more, at least. The background checks, are you representing all the boards right now with what you've just described? Your process? They're all
This is
catching up?
specific to Office of Healthcare Quality, what we
Okay.
described.
Are you going to be representing them in the next part?
I am not.
My question comes up, we heard testimony before this, that if we could consolidate a lot of issues, a lot of problems, that's what I'm getting to. Are you part of that?
I am not the person, to
You're not,
address that
okay.
question.
Okay. The last thing, the background checks that we talked about in here, that we didn't do on so many people, have you actually went back and tried to correct that? To do background checks on the providers that you've currently had out there that we questioned in the audit?
I think that, is that question directed towards the board or towards OHCQ?
To the process. I mean, we have 259 or whatever it was that we couldn't do background checks on, and that was an issue. And I just want to know, has that been addressed? Have we gone back and done the background checks on those people?
I think that is a question, so that is not specific to OHCQ, the
That's
audit
okay.
findings there, yeah.
Okay. All right.
Apologies.
Thank
but
you.
I don't want to, speak
That's
on
fine.
something I don't know about.
Thank you. Delegate, are you, okay, thank you. Senator Lamb?
Thank you, Madam Chair. Good to see you again. Just three brief questions. One, can you made a lot of prospective points about how you're resolving the issue, and hopefully this will be, there'll be some resolution to the outstanding kind of complaints and reviews that are still out there. But how did we get to this point? Like, what happened that got us to here? Because I think even though I don't want a Monday morning quarterback and go all the way back into history, I think it's actually instructive for us in this committee to know how we got to this point so that we can be cognizant about the future warning signs that we may need to pay more attention to again, so it doesn't reach this point where we're all digging out of a hole. And I think it was Dr. Ney that was the prior director of OHCQ. She's no longer here. She left in June 2024. You're obviously new. Director Witherspoon, you're also probably not as new as 2 months, but newerish as well. Can you give us a sense of what happened and what brought us to this point?
I think that is a very important question, and I think what I can say is Director Witherspoon and I were actually talking about that this morning. I don't want to sit here right now and give you that answer because I don't have it right, and I am still 2 months in, and I will say my hyper-focus since we got here has been right on where are we now and how do we keep going forward and make sure we don't get there, but I think we'd be happy to follow up on having some of those answers for you.
Okay. If you can follow up with us with some additional background on that, that'd be helpful. Did you say to Delegate Arntz that you're not sure who is doing the broader review of how these health occupations boards should be structured? Is there anyone in the department that's still doing this? Because I know former Secretary Herrera Scott was looking at this, and one of the reasons that she came back to us on the policy side of requesting shorter sunsets for these boards was because she told us that she was doing a top-down review of what the best structure and reporting org for all these health occupations boards should be. Where does that stand? Is anyone else picked up from that? Is that going anywhere? Anything back to report back to us?
Thank you. I can confirm that Secretary Herrera Scott was doing that work. I think we have to re-engage. We have the new leadership at our department. So I think we can absolutely follow up on that and re-engage with that work on looking at what Secretary Scott had done and following up with that. We could also follow up with you offline on where that may be going in the future.
So has anyone picked up from what she's done, or
we haven't yet picked up on that work.
Did she leave that work with anybody else? Was there anyone else briefed on that can
I don't have the answer to that question, but I will follow up and we can get that answer back to you.
Okay. I think it would be helpful to have that answer because she gave that answer to many of us that they were doing a review, that the department was doing a review.
Yep.
Hopefully that wasn't all lost in this transition. Hopefully somebody will pick up on it because obviously, as we discussed, there seem to be some structural issues that should be looked at with these health occupations boards. Last question then, I guess when it comes to, we've seen that there in these audits that understaffing seems to be an issue. You've kind of referenced that. And there's been a reliance on contractors. In this instance, that's probably correct because we need to dig ourselves out of a hole. So part of this is that it seems to be driven the fact that MDH, that a lot of these health occupations boards need the department's approval, MDH's approval, to use their own special funds. And can you just walk us through what process the department goes through in making decisions on when the boards can do something with those special funds that they have?
The answer to that question, but I will take that away and provide a follow-up document on that process. And again, just for clarity, this is the process on how the department provides approval for using the special funds.
That's correct, yes, because if they're going to use it for different things, like IT or other things, they actually need the department's approval to do that, to spend their special funds. And that, I think, has also been a concern and complaint from some of these health occupations boards, that they want to do certain things, and it's either very slow or they never get the approval to do that out of the funds that they have. And so that can be concerning as well. So, honestly, have not gotten many answers here to these questions. It's a little bit frustrating. If you can follow up with us, that would be super helpful here, because I think we're obviously very concerned about all of this. And, frankly, some of this should be answers that you should have off the tip of your tongue. So we'll see. Please follow up with us.
We will, thank you.
Thank you, Senator Lamb.
Delegate Lehman, go ahead.
Thank you. First of all, I want to thank our co-chairs, Senator Heddleman and Delegate Solomon, and thank you to the Maryland Department of Health and OHCQ for your, what I think is a really thoughtful response to this audit. So first a comment and a question based on page 6 of the audit findings. And the comment is that in this, I'm coming to you not as Delegate Mary Lehman, but as the daughter of a mom who was in a nursing home during this period, has since passed away. I just find it incredibly disturbing that you were not completing these inspections during 2020 to 2023, 19% at the peak of COVID. I cannot tell you how disturbing I find that. My family did have a complaint about the nursing home my mother was in, which is supposedly one of the better ones in Montgomery County, in Olney. It took more than 2 years to get a response until after she passed away. So this is personal for a lot of people and incredibly, incredibly disappointing. So my concern is on page 6, about the comment from the Office of Legislative Audits that despite this 7-year staffing plan, which I applaud you for, great to hear that, great to see that you made the conversion of a lot of these positions to merit positions. There were salary increases. That's great to hear. But despite this 7-year staffing plan where your goal was to add 74 inspectors, and then you, in fact, added 64, the auditors say that this increase has not had a significant impact on your ability to complete the required number of inspections. So briefly, what is your response to that? Because there seems to be a disconnect between what you're saying about your plan and, to catch up and what the auditing folks found.
Yeah, so first, well, thank you for your comment too, and I think I will just echo as well, I know we're going to follow up on what happened previously. I can't speak to that today. What I can speak to is I think this is very personal for all of us as well. And, I actually went on Monday and joined the team on a complaint inspection just so I could see it firsthand and could see, look at the quality and what was happening, and really have our commitment to really taking this seriously going forward. I think to the question, if I understood some of that conversation when I was sitting back there, I think that looked at up until 2023 with the audit findings, that despite increased staffing, they were still finding some of those challenges. And as you can see from, the audit, it's true, the numbers do highlight that. I think what we are here today to really say is that by focusing on staffing and maybe in additional ways, whether it is leveraging contracting staffing so we can get merit-based up, it is converting PINs, it is salary increases, but also part of the focus on efficiencies in a kind of more efficient training, in operational efficiencies, in survey time, in audit reviews, internal audit reviews, right, of our survey compliance. These are the things that we hope that, I think they were speaking to as of 2023 had not seen that impact, because that's when the audit findings were. I'm here today to say that we have put things in place where we do have positive numbers to report. We know we still have work to do, and we have, a long road ahead, but you have our commitment that we take this very seriously and will continue to do that.
Okay. I hope you will continue to make that kind of progress. If I could ask one more question. So the second question, I couldn't find it in the actual slides, but where there were a whole list of potential challenges to you catching up and addressing that backlog. One of them was funding constraints under COMAR requirements. Could someone elaborate on that? What specific constraints are you speaking about? Is that a gap between what you need ideally to address this backlog and what you're getting? What do you mean by that?
And speak to it more broadly. I think the one thing I will highlight is there's so much that is fluid here between the number of providers, what types of complaints we get, some of the other things that I think are hard for us to know exactly, right, what every year or even every day will look like. And so that's part of it, but I'll have Director Witherspoon speak more.
Yeah, thank you. I think what's important to note is that our federal funding has been flat for quite some time. So a lot of the work that we do is taken from the state general funds. So a lot of the things that we do on the survey side that we should be reimbursed for from the federal government, we don't get that type of reimbursement. So when we're looking at increasing our oversight, increasing the amount of revisits, increasing how often we're going into these facilities, unfortunately, we have to pay our staff to do these things, and we're not always reimbursed on the federal level as we should be, since the funding has been flat since about 2015.
Okay, I'd like to follow up offline with you then on this issue. That's concerning. Thank you.
Thank you. Senator Brooks?
Thanks, Madam Co-Chair. Thanks. On the complaints, you were saying that if complaints are large, you sort of triage that, and then if from that, if a provider is not, if the provider is not licensed, you still would send an inspector out. Yeah. Is it not illegal for a provider not to be licensed? It is. Okay.
That's why we engage with the Attorney General's office when we are finding these things. If we go there and we find that there are residents or what appears to be you are providing care for folks in this facility, our staff does not leave. We are staying there. We are making sure that these residents are discharged appropriately to either other facilities or family members. We are engaging law enforcement if it rises to that level, and we're also making referrals to the AG's office. We have a very good relationship with them, and we talk to them quite frequently about these things, and we will make a referral to them if needed.
Okay. Okay. Now, if when that does happen, what kind of time frame are we talking about getting those patients moved to a...
That day.
That day?
Yes,
oh,
sir.
Okay.
Yes, that day.
Okay.
So if our investigators, if our inspectors, surveyors go out to an unlicensed facility and we can confirm that there are residents there, that you are taking care of these residents and it's not a family relationship where it's a family member caring for another, but this is, in fact, you are licensed, you are operating as an unlicensed facility, that day we will have those residents removed from that facility.
All right, thanks. Thanks very much.
Mm-hmm.
Thanks, Chair.
Thank you. I don't think there are other questions, but I share Senator Lamb's concerns. I think that what we will hear shortly and what we have read in the audit of the different boards concerns us with regard to accountability. And I know that there is a relationship between the department and the boards, and especially with regard to payment and other issues. There doesn't seem to be we don't seem to know where the buck stops. And so I think, if you have any comments on kind of the department's relationship with each of these boards and holding them to account in a variety of ways, some obviously need it more than others, I'd be interested to hear that in addition to the follow-up that you will provide in response to Senator Land's questions.
I will say, for audits in general, the department is just trying to be more structured in monitoring the responses. So not just for this audit, but all of the audits that we are coordinating, we are in developing the responses for findings, asking programs, and in this scenario, including the boards, to provide us with definitive milestones. So if they indicate that they're going to address the finding by implementing process X, we are asking them to tell us what are the steps along the way to process X. So step 1 by this date, step 2 by that date. And so now with these more structured milestones, we can better track whether a board or an MDH unit is on track to actually complete that finding.
And does that fall within your purview as Deputy Secretary for Operations?
That is a new process that I have asked to be implemented. So we are with our audits as of, we started this on 2 audits that were completed this year, including this one. We are asking for those specific milestones. So we can then report up and escalate if we're seeing progress not being moving forward as we expect.
And then we can check in with you as well in terms of any sort of follow-up that might be required internally.
Absolutely. Again, it's a tool for us because I think in the past it's just been a commitment to follow the finding, but there's not an ability for us to track how that's actually coming along. And I think that's why sometimes we see these repeat findings because folks don't follow up on the steps required.
That's good to hear. Okay, thank you.
Absolutely.
And I appreciate that. I want to echo the co-chairs, Senator Hedelman's comments and Senator Lamb's. I wanted to wait until we were finished with the inspection conversation because I think many of us share those concerns. And frankly, I'm also dismayed that it seems like we're just playing a game of, nobody seems to be responsible for it. I guess I want to ask, this is an opinion question for you, and I will readily admit, I am somewhat new to this space. I mean, I monitor it, but I don't sit on the health committee, and this isn't sort of my purview on appropriations, so coming to this was very fresh. Madam Undersecretary, you've only been here for a few months, so I'm actually very curious in your opinion on this. Looking at this from a new perspective, I was horrified that we have essentially, I think as Senator Lamb mentioned, we have like 23 independent agencies. From efficiency standpoints, in a time of tight budgets, it's crazy. From an accountability standpoint, it's crazy. If you were coming in and defining and creating this from scratch, do you think it makes sense that literally, if one of these boards has a horrific problem, you apparently don't seem to have any authority to tell them you need to fix this? Like, how would we, if we could wave a magic wand, how would you redesign this in a way that would still allow some autonomy, but create a system of accountability so we don't have these recurring problems?
First, thank you for that question. It is a very challenging question, right? And I think you'll say, as you know, I'm new to this role and really came to, prepared to talk about Office of Healthcare Quality. But absolutely, I think share and as well as Deputy Secretary Hackett's sentiments that this is an incredible priority as well and needs to be. I have had the opportunity to engage with many of the boards through the work that I do as Deputy Secretary for Public Health, whether it's on vaccines and provider guidance, and have seen the importance of those boards, right? As a provider myself, I know the importance also of many of the things they function, but I think I'm still learning about, as you just said, what it looks like. I think based on the discussion I've heard today, do agree, I think, with everyone that there's opportunities to look for places that we can streamline. I think that's why, and I know that our colleagues are here to speak about some of the improvements that are already in place, but I do look forward to continuing with MD leadership to look at this further.
Great, and I did just have 2 quick follow-up questions. So, and this is for anyone on the panel, does it make sense that half of the boards have requirements for background checks and half of them don't? From your perspectives.
So the inconsistency is definitely challenging from a compliance perspective. Yeah.
Yeah, it didn't make any sense to me that we have the Board of Pharmacies don't require it, but other practitioners do. And then I guess this is just maybe a very direct question. So to your comments earlier, Secretary Hackett, you were saying that you're going to do a monitoring of the audit findings. If you find issues, if you continue, even outside this audit, if you find that there are things going on, do you have authority to step in and tell them, hey, you should fix the fact that your investigations or your complaint rate is off the charts and you haven't been closing them, or is it merely an advisory function? And then if you don't have the authority, how does that get fixed? What's the process?
Yeah, I think you're absolutely right. There's not that statutory authority for us to direct the board. I think any of the boards right now to follow that compliance model. But I think that's food for thought for future conversation for how we can implement that compliance. I think within the levers that we have today, I think we would just be having conversations with the board and just continuing to monitor and report out on where those shortcomings are. But outside, we just don't have that statutory ability to direct at this point.
Do you get regular monitoring reports from each board?
Not from an audit perspective. I believe that once we have, with this, starting with this audit and with that milestone strategy we've implemented, we're hoping to start putting together some quarterly updates on where folks are in trying to complete what they said they would be doing to address the findings.
But if one board decides not to do it, you don't have any authority to make them do it?
No, that's correct.
Okay, thank you. I don't think we have any more questions, so appreciate you all being here, and I think we're going to move to a presentation from the Maryland Board of Nursing.
Please, go ahead. Thank you.
Okay. Good morning, Madam Chair, Vice Chair, and members of the committee. My name is Rhonda Scott. I am the Executive Director for the Maryland Board of Nursing, and accompanying me today are our Director of Enforcement, Ms. Sarah Tung on the end, and Mr. Michael Rogers, our Director of Information Technology. Thank you for the opportunity to speak with you today. Next slide, please. So what we're going to do is just provide updates on the corrective actions that the board has made since our initial responses to the audit findings. And we're looking at some key areas, and we're also going to highlight areas of improvement since the audit findings and our initial report. Next slide, please. So with regard to finding one, which spoke about the 259 potentially fraudulent licenses. Our initial response showed that we actually processed 205 of the 259 and found that the state of Maryland and the Board of Nursing had no jurisdiction to take action against these individuals, either because they had they weren't licensed in Maryland, they had no privilege to practice in Maryland, or they didn't have an application for licensure before the board. The remaining 54 cases, we initiated active investigations into them. 28 of them were cleared through the board's investigatory processes and left us with 26. Of those 26, we have 4 remaining cases that the investigations have been completed and will be submitted to the board in November for a decision. We've also established contact with the Office of the Attorney General for referral guidance, and we've had a meeting with them yesterday, and we're working through a process for referrals. We've also established and redesigned a tracking log to document full investigation life cycle from the day of the complaint all the way to disposition. Next slide, please. With regard to finding 2 and the timeliness of investigations, so a lot of our problems with timeliness of investigations involved a lack of resources, namely and specifically not having enough investigators to conduct the investigations. We are actively recruiting for 7 vacant investigator positions in collaboration with the Office of Human Resources. And one of the things I will share is that the board is currently, the Secretary of Health currently has statutory authority over the board's infrastructure, operations, and staffing. And that began with House Bill 611 in 23, signed into law May 23. And with that, we have been able to acquire additional positions that has really helped with implementing and addressing some of the issues in the findings. We have also, again, like I said, we have a complaint tracking system that's been revised, and with the new licensing system the project that has been underway, we plan to incorporate complaint tracking into that system. Next slide, please. With regard to the collections and cash receipts, additionally, we brought on additional staff for administrative services, fiscal, and director of operations who's assisted in addressing the concerns in the findings with regard to cash receipts and collections. We have implemented internal audits to ensure compliance with controls that we've implemented. We've also implemented a system to reconcile services rendered with the fee collected. Quarterly audits are completed to ensure appropriate staff have access to the appropriate fiscal accounting, as well as reconciling and segregation of duties. Next slide, please. So, like I said, we really wanted to highlight some of the key areas related to audit findings, and as I stated, since the signing of House Bill 611, which was our sunset extension in 2023, the department, along with the board, have made significant progress in several primary areas identified by 2 independent evaluations. And these are areas that are related to the OLA findings, which we will highlight. Of course, the complaint investigation, information technology, and staffing. Next slide, please. So back in May of 23, in accordance with the House Bill 611, the department did release an RFP for an independent evaluator to assess the board. And we were able, in conjunction with the department, to procure an independent consulting firm that initiated and completed the evaluation. Next slide, please. In addition, and actually succinctly, the Office of Program Evaluation and Governmental Accountability also conducted an evaluation of the board's infrastructure processes and things like that. And so many of the findings that you can imagine overlapped and were consistent. We do know that OPEGA actually solicited direct feedback from our constituents, customer service. They looked at our constituent services responses to inquiries. And what I'm very pleased to say, we have no outdated inquiries at that time, which was probably early 2023, I want to say January, February. The response was we were about 118 or so inquiries behind in responding to customer service inquiries that came through the department's constituent services. Today, we are not behind on any. We keep up with them. They are, we make first contact with our constituents almost immediately, if not within the 48 hours, to resolve their concern in less than a week. Next slide, please. And as far as progress with our complaint investigations since the signing of the bill and the relationship with the department allocated in October of 2023 10 non-nurse investigator positions to assist with clearing the backlog of investigations. We are still in the process, as I said, of hiring staff. We've also looked at our classifications for our investigators, which have been updated to obtain qualified individuals to assist with investigating and closing out these cases. In January of 2024, the board voted to delegate authority to the board investigative staff to administratively close all cases that are 2019 and older, and these are based on recommendations from the independent consultants. The board also delegated authority to complaints and investigation staff to triage new cases and assign priority levels in accordance with the National Council for State Boards of Nursing guidelines. Each complaint is reviewed the same day it is received, and one of the things that we have recognized is that the intake to triage time has actually decreased from 58 days to under 24 business hours. Non-priority complaints are reviewed by a board committee and is recommended for what we call a take no action, and what the board will do, that will be taken to the board for ratification at the monthly board meeting. Next slide, please. Some of our reconnection and security updates. So when the department experienced the network security incident in December of 2021, the board had operated without a hardwired connection up until June of 2023, when we were reconnected to the department's network for the first time. We are upgrading both physical and information security systems. Our licensor system has been migrated to a secure server. We have upgraded devices for staff, and the current database was migrated over from Oracle to Windows, and so we're making substantial strides with our security and IT infrastructure. Next slide, please. And this continues the IT updates and progress that we've made, which upgrading our legacy phone system. And I know many of you can probably speak to the complaints that you received about, the ability to reach the board. We've done a lot of work and made a lot of progress, and we know there's more work to be done, but the upgrades that we've made, we've seen substantial progress. One thing I would like to share also is that in January of 2023, we were at a 1.2 Google rating. We're now at a 3.5, and while we're not at 5.0, we are working towards it, and we feel like we're going in the right direction. And like I said, we know there's much work to be done, but we feel like we're moving forward and moving in the right direction. Next slide, please. So one of the key areas that we identified as relating to the issues that the board has had with complaints and cash receipts and other areas identified by the audit is lack of resources, right? To specifically staffing. So we did receive approval in late 23 for positions, requests to support new and competitive hiring. We have received ongoing support and assistance from the Office of Human Resources with timely recruitment. Since then, we fill key positions critical to addressing the findings outlined in the report, which includes Director of Information Technology, who has forward thinking and ability to take us, further. Director of Operations, Fiscal Manager, Fiscal Assistant, additional administrative staff. And additionally, we've established a Quality Assurance and Performance Improvement Unit. We've hired a manager, and we are recruiting currently for a director to lead the unit. We recognize that a lot of these findings starts with internal accountability, internal auditing, and recognizing what we need to improve upon ourselves. One of the things also, we've taken a multifaceted approach, right? We've also looked at employee needs and, employee recruitment and retention, morale, and employee satisfaction. So we feel that employee engagement is key to helping staff know where they stand and align themselves with the mission of the organization, and leadership has made internal communication a priority. The department has also been regularly hosting town halls for employees. The current secretary is also hosting meet and greets. The board has also implemented team building, morale boosting events and exercises. We also meet regularly with the Labor Management Committee representatives, and just that focus on retention and recruitment, and employee satisfaction had made the world of difference, and we think that is also something we can attribute to the improved customer service ratings that we've seen. Next slide, please. So just to close out, on July 27, 2024, during its open session meeting, the board voted to extend the Secretary of Health's authority over the board's infrastructure and HR operations for an additional 5 years. The following was discussed during the board's decision: successful partnership with the department and overall support from the Office of the Secretary, continued operational support from the department, technological expertise during upgrade of our IT infrastructure, support with timely recruitment and onboarding of staff. And so during the 2025 legislative session, as you all know, the General Assembly passed the board's sunset extension, which includes the Secretary's authority over the board's infrastructure operations for an additional 5 years. And so we're really confident that this ongoing partnership will assist us with continuing to improve on a lot of these findings and just do better for our constituents. Thank you.
Thank you very much for the presentation and for updating us. I just have a question, and there's certainly been a lot of change at the Board of Nursing over the past few years. I understand you are not new, but you've been at the board for a while, but a couple years for this position since the changes have been implemented. And I find it very fascinating too that the board voted to extend the secretary's authority over the board for another 5 years. And it seems to me, as somebody from the outside looking in, that this has been a very positive working relationship. And so you were here when we were talking about some of our frustrations or concerns about accountability with regard to other boards. And I just will give you another minute to talk about the positive effects that you have had in having a more, I would say, close and accountable relationship with the department?
Absolutely. I mean, the support specifically with the ability to recruit, folks that are able to do the job. Recruiting has been helpful with OHR, the Secretary's office, when we have, with our IT infrastructure specifically, and working directly with them on the electronic licensing and regulatory management system project that's underway, right? There's a lot of support there that's very helpful. We're working directly with that team. And the vendors, we're working with them and our subject matter experts on business requirements. So we're very excited about that project. And what I can say is the support from the department has been very instrumental in, not just implementing and initiating, but just ongoing support is very important. So we feel like the relationship that we built with the department is a beneficial one in many ways. And once we are back, to our independent status at some point, I think that has set us up to be successful, just to move forward and, in the direction that we're going.
Thank you. Appreciate it.
I just want to let the members of the committee know, so while these are folks from the Board of Nursing, we have representatives from the other boards here as well, so this is an opportunity for the committee members to ask questions as they pertain to any of the boards, as well as the Board of Nursing. I think Senator Lamb, go ahead.
Sure, thank you, Mr. Chair. Just a follow-up question to you on that. Are the other directors are not coming up, right? So if we have questions specific to them, they're not all coming up together? No. Okay. Gotcha. I guess my question, similar to the last panel, and obviously a lot of progress has been made. This is very positive. I think, things are finally turning a corner, which is great, and moving in the right direction. What happened here? And I know you weren't here then. There's actually been a cycle of new directors coming through, and I think it would be instructive not only for us to have some sense of what those warning signs are, but there are other health occupations boards that are similarly broken, like the Board of Social Work kind of comes to mind, and others as well, that I think can use some of the level of reforms that we see here. But in terms of what happened, just so that we can be cognizant about those warning signs, what's your sense of what happened here? Is it really just kind of a staffing issue? It seems like a lot of it was just kind of bringing in new staff, acclimating them, getting them trained up, going through a process that's more systemic and faster. If you were to say 1, 2, and 3, or 1 and 2, what were the big issues that led to this?
Tenure, which has been 6 years, and I started out as the deputy director, so I can tell you resources was a big concern that we've had. And, we learned that you can put new process into place and develop standard operating procedures, which has been a focus, but we need resources to implement and continue, right? And we also need to ensure that the staff that we have, right, have satisfaction in our job satisfaction. They are happy about what they do and passionate about what they do. And we've engaged, we do a lot of communication and engaging internally with our staff that we have, but I would say resources was the key for us initially.
It's back to just having adequate personnel, resources, support for what you're doing. The second question I had was, I guess maybe this is more of a comment, but I assume you're aware that the department is planning to include a provision as part of the departmental package to require background checks on everyone. Is that correct? Is that your understanding?
I'm not sure the Board of Nursing already requires
it's in some of the
checks.
briefing documents that have come to us. So to answer the chair's question from the prior panel, it looks like they will be including background checks as part of their departmental. So.
Yeah, actually, that was a question I had. Some of it said you were pursuing it, some of it said they're reviewing. So.
Yeah.
If someone at the department can get back to us with clarity on whether that's actually going to be part of your departmental, probably at this point it's working its way through the process, or it's worked its way through the process, or is it still just a review? Because I think all of us probably agree that the background checks are important. So, thank you.
Yeah, Delegate Aaron's, go ahead.
Good, sorry. I appreciate your responses here, and I guess I'm really concerned and confused a little bit about, you're addressing most of the audit here, and that was done. And I wonder, in the business model, what you're doing in the future, that the audit's not going to have to expose these things, that internally these things will, you had to know you were behind. We had to know all these issues in the past. And why they weren't addressed is obviously you've come up with staffing's an issue and all that stuff. And I get concerned that we could fall back into this at the next audit because somebody dropped the ball again. And I'm not convinced that this is the best way to do that. I would think internally you might be able to address these things, knowing you're falling behind, knowing that these things aren't done. And I was wondering how you will do that.
Once we started improving our resources and getting more staff, we look at processes, look at streamlining processes and what we do, because at the end of the day, we need to have realistic expectations, but we also have to focus on the end goal, which is meeting the needs of our constituents. And so we implement standard operating procedures that streamlines processes to work more efficient and be more effective. And we also looked at continuity, whether it's leadership succession and other things, so that if someone leaves, we can certainly continue and move on and business doesn't grind to a halt. And I can't express enough the importance of employee satisfaction and engaging internally with staff so that they, they are passionate about what they do and they enjoy coming to work and doing the job. And with the audit findings, like I said, we establish our own internal quality assurance and performance improvement unit. And so that function is going to be served internally as well, holding us accountable internally for all of the audit findings, ongoing compliance, and just speaking to what, our constituents need.
To that, though, I guess I wonder how it happened in the past, because this is something that should have been going on from the beginning. You're aware of it, we're aware of what we're doing, our quality and all that stuff. That's a concern to me. And I guess to further go back on this background check thing, since you are the chief and all that stuff, are you concerned about background checks? Is that something you're concerned about in your business right now?
So the Board of Nursing already requires background checks of its licensees and applicants, licensee and certificate holder applicants. That's not something that we don't do. We've been doing that. Yeah.
% with you.
Correct.
Okay. All right.
Yes.
Thank you, Mr. Chair. Thank you.
Well, actually, maybe, do we want to have, Undersecretary Hackett, do you want to take that? Or I know we have another representative who's here sort of representing all the boards, because while obviously the Board of Nursing has it, I think Delegate Aarons' question is more for the other 10 that don't and the inconsistencies across the board.
Follow up on what Senator Lamb indicated about the potential departmental, about requiring this in statute. I think that would be helpful. I was not aware that that was one of our departmentals, but I will follow back up and get back with you. That would be helpful.
Just briefly on that, are you saying that you don't know if they all will be united on this? Or you're going to have to check with them, or is this something you're going to push for?
Sure. I think all of the boards are supportive of that, because I think this was sort of something that kind of bubbled up as part of this audit, that it came to light that not everybody was consistently doing the background checks. So my sense is that the boards are supportive of going in that direction. There's just a necessity to have that in statute. So I don't think that would be an issue if that was promoted, via legislation.
This is really important. I would really love to see an answer on that.
Okay.
Ms.
Thank you.
Smith-Williams, could you speak to that? Can you approach please? And can you introduce yourself, please?
Executive Director for the Board of Acupuncture and acting on behalf of
You can
boards.
sit together. Thank you, Rhonda. I won't go far. I'll just go back.
We did take seriously the findings of the audit. And I've only been here since 2022, but my understanding from more tenured staff is that sometime in legislative history, there was another mention that enough boards weren't doing criminal background checks, and that it was decided which ones they would put a bill in for, and then they would follow up with the rest of us later. Apparently, by the time of the audit, that had not happened. Since then, all of the boards have worked together with our legislative representative to do a bill, which is being discussed with the department. department, floating whether or not the department will be the sponsor of the bill or whether we should go out and seek a separate sponsor for the bill. So it's in play and has been for some time,
Thank
since
you.
the audit.
Yeah, I think, and to Delegate Aarons's point, in the past, the Joint Audit Committee has submitted bills on behalf of the committee, and so I think it's something that we've had some preliminary conversations on, so we'd be really interested in working with MDH, and if there is, draft legislation circulating around internally, I think we'd be very interested in, as a committee, pursuing that.
And just to another 2 points of clarity, the bill has some boards who don't have either access to CGIS right now or RATBAC. Some boards do have access to CGIS but not RATBAC, and they're adding that. Additionally, the Board of Optometry, which was added, I think, in an oversight in 2024, they received their approval to do both CGIS and RATBAC. However, the CGIS delayed getting them their ORI number, I believe it is, and I don't know the reason, but they have since received that and they're moving forward with their process.
Great. Yeah, I think we would probably want to pursue some level of consistency across all of the boards. So thank you for that.
Senator Brooks? Thank you.
For the executive director, I appreciate a lot of the things that you've done to address some of those major concerns, but I do see the one that sort of drew my attention, that was the $386,000 in unrecorded credit card collections. Yeah, and I guess perhaps, like you say, there was a lack of resources, and I can give you that. But that too would suggest there was a lack of internal control. I do see where you sort of segregated some of the duties. Where no employee has dual capability to collect fees and issues licenses and certificates. So it is refreshing that that those type things have been addressed. I would guess maybe were there receipts coming in from licenses and whatnot from online, or I'm just trying to figure out how does that amount just get not recorded?
That's what we've been trying to do, and the board has done our due diligence to research this finding. Naturally, it's not one transaction. So without more information on the dates or the types of applications, it was hard for us to really do much more investigation. And we did. We went through a process. We worked with the department on investigating, and it's just not something we can follow up on without more specific information. And some of our deposit processes are outside of our control as well. So it's just the ability to dig deeper and research the issues or how it even originated is we just can't do it without more information. Yeah.
Now, is there daily reconciliation now?
Yes.
In place? Oh, okay.
Yes.
All right, good.
Yes.
All right.
You're welcome. Thank you.
Before we move on, I did just have one or two more questions. I guess more broadly, getting back to the complaint piece, and I want to just say the data that you shared from the Board of Nursing, I think is fantastic, and really appreciate all the work that you all have done to not only reduce it, but then cut it in half. And I think it's really, as Senator Hellman mentioned, I think it's instructive that after there was legislation to at least administratively bring you under the Department of Health, statistics changed a lot. So I guess one of my questions, particularly on the complaint resolution pieces, there were some inconsistent answers in here from some of the boards about the time frame that MDH sort of advises not being useful or helpful, and some of the boards in their responses, and we didn't get them all, were complaining that they didn't feel like the guidelines were even appropriate. Can somebody expand on that? And maybe, I guess it's again Ms. Smith-Williams as the representative of the other boards, or Undersecretary Hackett.
When I joined the board in 2022, I was coming in on the tail end of an audit that had been completed in the interaction with IACS. The complaints were a concern then. We worked with the budget office about the standards for the MFRs to adjust them because I think the concern was the guidelines or the benchmarks are probably decades old and had never been re-examined. So we did make a tweak for the small boards. After discussing what it really takes to triage and decide what to do with a complaint. And we're in the process now where that's maybe 2 years old. You don't want to continue to make changes without really seeing what your outcomes are. So even though I know these numbers still don't look great for some, for the small boards, the numbers definitely have improved. The complaint rates are better. Collectively, we are at 91%, which I mentioned in my memo. I know the benchmark is 95, so we are getting there. But some of the small boards also are at the 95 or 100% benchmark. They're doing much better. And we're in discussions again with the Board of Physical Therapy being our lead and talking to budget and looking at the MFRs and deciding if the standards are great, if we should leave them as they are to test a little bit more, or if we should tweak them again. So we are reviewing the processes actively.
Okay, so then some of these listing here where it says open more than 2 years, this was as of February 2024. I guess maybe seeing updated numbers would be really helpful. And again, even what's in here is not every single board, but
So-
some of the,
I was going to say, so the audit covered 19 to 23.
right.
So you're looking at numbers that were from the past, and like you said, going forward, if you look at, say, the MFRs that have been reported for 24 and 25, they do look different.
Okay. I was going to say the data that's in the audit, they have it up to February of 2024. And then I guess the last question, and it goes back to sort of the systems issue, but would be curious your thoughts on this. I mean, it seems kind of crazy to me, like one of the, I think it was the dental examiners board said they have a Google Doc that they maintain, and somebody is responsible for going in and updating when a complaint comes in to get it into the Google Doc. I mean, I'm a little incredulous on that. Like, God forbid a staff person is out for a couple of months. Like, who's updating the Google Doc? Who's going back in? I mean, it seems like it would make your lives much easier to have sort of an enterprise software system that was managed by MDH that, you know, if I'm making a complaint as a member of the public, you know, for a pharmacist versus a dentist versus an optometrist, like, there's a portal. I go in, I file that complaint. Very easy to create a system that then routes it to the board. There's somebody centrally in MDH who monitors. Just to, you know, again, we're not talking about taking away your autonomy on running your, you know, specific profession, but on things that I think members of the public expect there to be some sort of consistency on. It's like, well, why did this board take longer? Well, it's because the Google Doc didn't get updated. I just be curious your thoughts on that. I don't mean to put you on the spot, but you are the one representative.
No, I appreciate that. I think we all do. And it's great that we're opening that conversation because also when I joined, of course, we had the cybersecurity attack in 2021, and then we had the shutdown due to COVID. The boards paused working on some things during that time, which you will find is that they did not stop issuing licenses, even though they were compromised, or because we were working from home. So once we opened back up, again, with the Board of Physical Therapy being our lead, we constructed an RFP to submit, to start looking for enterprise systems to upgrade and modernize what we were doing. When Secretary Herrera Scott came on, we had a meeting and she discussed that she was also looking for something for the Board of Nursing. So she asked us to pause what we were doing. Not say put it out of our minds completely, but pause it and remain open to what she was doing with the Board of Nursing to see if we could all come on that together. So when you say that the Board of Physical Therapy is at the table, that represents the small boards being a part of the process.
I'm just going to follow up, and you're the person who's representing all of them. So I'd be curious about your thoughts with regard to some of the other systemic issues that we have discussed today. And that is not just the complaint system or the investigatory process, but hiring and personnel systems. Some of them also are still using paper. Whether there wouldn't be a number of efficiencies and reducing redundancies for having a more centralized system for some of the administrative issues that each of the boards faces, whether it's hiring, whether it is complaints, whether it is IT, although maybe we'll put that in a separate category, or other matters, administrative matters. Could you comment on that?
Sure. Just briefly for the IT piece, 14 to 16 of us do share an IT team, and we were able to work together collaboratively to upgrade our phone system. So I think we do have a history of working together. We meet at least monthly as a group, and then, of course, separately as needed. We're breaking it down into committees or little subgroups to address things. But administratively, we do look for efficiencies to improve our processes and ways that we can collaborate to do that. Those talks are still in play, but because the boards are, say, staffed lean, we do spend a lot of our time and our resources making sure the work gets done, and then we're dedicating extra time to make decisions and pull things together. So sometimes it takes a little bit longer to turn the ship because we're stretched in doing that work. I don't think there's anything that you all have mentioned that are also not on our very long to-do lists, and things that we talk about all the time and how we strategize to get there. Which is why I say for physical therapy, whose board has a lot more staffing resources, will take the lead on doing the RFPs and helping us work through those processes. Because I can tell you, I'm a board of 2 staff persons, and working on the telephone system change and working through all the different departments to get it done in procurement can be onerous. But I will say to you, we're pushing to get it done. Some boards have leadership changes more frequently than others. Fortunately, my board had the same director for 30 years before I got there. Right, there's the consistency. Every board does not benefit from that, and that can also, as you know, be a big issue of consistency in what happens. But again, I think moving forward, we can't change the past, but we know what the future holds for us. We're willing to sit down and talk about being collaborative and being open to administrative efficiencies. I don't think we walk around in paranoia about, losing autonomy. Our goal is to meet the mission and do it the best that we can. And I think that our autonomy really stems from our ability to, as you said, police our professions, and to do the best by the public as well as the licensees.
Thank you. Appreciate that. Senator Hester?
Thank you very much. And I'd be open to any of the other boards who want to answer this question to follow up with me offline. Don't mean to put all the pressure on you. My question is, back to the licensure, the ongoing conversation I've had with Secretary Herrera Scott for the past 3 years about changing IT for all the boards. If you were at the table as a small board for those, did your discussion focus just on the new licensure system, or did it talk about IT support kind of generally? So I guess that's my first question. Did you talk about both? And then, given that it's Department of IT that's now providing all these services to the Board of Nursing, which is where we're seeing the improvements, would the shared IT team across the smaller boards, do you think that they would be open to working with the Department of IT to try to bring all of the boards up to the same level in their infrastructure that the Board of Nursing is now at?
We'll find with the Board of Nursing having that support, as you know, physicians has their own IT team. Our concerns with being connected or pulled into the pool of mainstream IT resources, I would say, in the past, has been that we're going to put you in the pool with everyone else, and that you're going to go into the ticket system and we're going to be able to address you based on whenever we get the ticket. And for us, that is a concern. So we have our own IT teams to address our unique needs, not because we don't want to be a part of the mainstream system, but because we don't want a generalized system to be able to slow down the specialty work that we do. So that is how you probably got to that point.
The state of Maryland has said the same thing to me before.
Well, you probably understand if you think about, the IT team serves thousands of people, and you put in a ticket for something that's keeping you from meeting your deadline to issue a license, and they say, we're going to get back to you in a week.
Yeah, no, we do it. There's a capacity problem there, too.
Yeah, and it's not speaking poorly of them, it's just the volume of work.
So in the work that Secretary Herrera Scott was doing, were you there at the table for the larger licensure, IT kind of conversation. But the other stuff was not addressed, or it was addressed?
The licensure system piece, I was there when we talked about pausing the process. When we meet monthly, Rhonda does share the information that she can with us about what's happening, and Lori from physical therapy is sitting at the table for us. So we are basically watching the progress of the nursing system. Hopefully we'll be engaged to give that input so that we can become a part of it. I can tell you under, say, Secretary Schrader, if you want to go back even further, we were looking at this. The vendor that it was his suggestion sent us a proposal for a $50 million system with a 4-year implementation plan, which we didn't think was sort of reasonable. So again, that's what led us to do our own RFP and move forward before Secretary Herrera-Scott came on. So again, it is forefront in our mind. It is a priority. It's probably just the pace and the rate at which it's happening based on our own resources to do the work.
Much, appreciate you.
Hi, everyone. Christine Fairley from the Maryland Board of Physicians. I'm the Executive Director. Senator Hester, I just wanted to comment just briefly. We have our own IT team, and I can say emphatically that the Board of Physicians would not be where we are if we had to rely on DoIT. We were able to now put all of our applications online. We're licensing individuals within 3 business days. You know, things like that would not have happened if we had to rely on DoIT. I would also say that the Board of Physicians has its own IT system that we developed. We own the source code, so we pay nothing. You know, so it would be difficult for us to then join on with all the boards because the Board of Physicians, unfortunately or fortunately, has a lot of money, and then we're expected to contribute more, you know, toward these shared services. But I do want to emphasize that there are a lot of shared services. You know, we do share, we pay the department and we share, you know, the resources of OHR, Human Resources. We also pay DoIT, we pay a fee to them. You know, so there's all of these shared services that are already in existence. But I did want to just comment, like for instance, we wanted to just recently, in beginning of August, we had a meeting with DoIT about doing another security layer on our webpage. Still up in the air. We've written to them pretty much every other week since then, and we have no answer. So it is very frustrating because we could already have that in place. So thank you for listening.
Thank you. With no further questions, thank you very much. I'd like to call up now the Office of Performance Evaluation and Government Accountability, and we'll take a look at the State Board of Professional Counselors and Therapists.
If you're ready, thank you, Chair Heddleman, Chair Solomon, and members of the committee. My name is Mike Powell. I'm the Director of the Office of Program Evaluation and Government Accountability. I'm happy to be joined today by Corey Mitchell, who's to my right, who worked on this report, as well as Tori Hall, Ben Reese, and Sarah O'Donnell, who are also with us. And before I turn it over to Corey, I just wanted to say why we did this. And we did it because I thought there's a workforce shortage in this business, and I am guessing that demand for counselors and therapists in Maryland may be as high as it's ever been, and it's an important profession, and we wanted to understand if the board was doing everything it could do to support that profession and the people that want to see a counselor and therapist. And last thing before I turn it over to Corey, I also want to clarify, when we think about someone who's a counselor or a therapist, only about half of them are actually licensed by this board. A majority of the other half are licensed by the Board of Social Work Examiners, and then there are a couple of other people that practice as counselors and therapists who are licensed by other boards and are in other professions. So thank you for having us, and with that, let me turn it over to Corey, and my guess is we can go to the next slide.
Good afternoon, everyone. Again, Mike said, my name is Corey Mitchell. I'm a program evaluator within OPEGA. On this slide, our evaluation covered the period of 2020 through 2024, and during that time period, we show a history of the number of regulations for this board, but during the 2020 through 2020 time period, the number of credentials increased by 36%. Also on the slide, you can see the board manages five separate practice areas: professional counseling, alcohol, drug counseling, behavior analysis, marriage and family therapy, and art therapy. Next slide, please. This is just a layout of the board's organization. As you can see, you have the board members, and you also have an executive director who is hired by the board, as well as and works for the board, and a newly appointed deputy executive director position. Further down, the more day-to-day operations, you have the compliance unit, which handles the investigations for complaints. And you also have the licensing unit, which handles the processing of applications. And to the far right, it's come up in other presentations, but we do have shared staff. And so there are 16 of the smaller boards, this board included, where there's shared staff, and the pay for the staff is shared amongst the 16 boards. They're not solely dedicated to this board, but their support is shared amongst the 16 boards. Next slide, please. Another thing we took a look at was the executive director turnover for this board. This board went through 9 executive directors since 2020. 2 of those executive directors were actually acting. The median tenure for an executive director for this board was 7 months. The current executive director has been in position since February 2025. Next slide, please. This slide, again, during 2020 through 2024, the number of regulated credentials increased by 36%, as you can see by the orange line, whereas the blue line represents a decrease in staffing, and staffing decreased by 17%. The staffing is clearly, as you can see, not on pace with the increase in credentials or workload. We'll talk about that more in other slides. And this does impact the staff's ability to process applications and complete investigations in a timely manner. Next slide. The days to hire new staff, we did look at staffing for this particular board. And on average, it took around 15 months or 488 days to fill a vacant position. A few contributing factors that we noticed during our evaluation: the board does not have a dedicated HR professional to interact with MDH, and so they're very reliant on MDH OHR for staffing. And then, as we saw in an earlier slide, the executive director turnover did impact staffing due to paperwork either being delayed or lost with executive directors coming in and out. Next slide, please. This slide shows merit positions versus contractual positions. So you can see the orange bar represents unfilled positions, where the blue bar represents filled positions. And it's pretty obvious from this chart that there are more filled positions for merit than contractual. And that's something that we've seen in our evaluation. Contractual positions had an average vacancy rate of 69%, where the merit positions had an average vacancy rate of 13%. Clear disparity there. Contractual positions, as we probably all know, especially the boards, are harder to fill and retain than the merit positions. And again, this board is very dependent on MDH and DBM in terms of converting contractual positions to merit positions. Next slide, please. The state uses constituent service management software called Internet Quorum, or IQ, service records. to track interactions between the government, agencies, and the public. And typical IQ records are mainly inquiries about status of applications. Sometimes they get inquiries from people who are out of state that want to practice in Maryland. So those are the majority of the records that come in to the board. This chart does show a spike, especially in 2024, represented in the blue dashed line. And just of note also, during some of our interviews, during our evaluation of board members, all the board members were not aware of this data. Next slide, please. And as you can see, as I talked about in the previous slide, over half of the inquiries are about application status, 55%. The next largest would be 29% of practice-related questions about telehealth, out-of-state practitioners wanting to practice in Maryland. And you can see the breakdown of the other ones there. And again, these are not primarily complaints. These are more inquiries. So there's a different system that handles the majority of complaints against practitioners, which we'll show later. Next slide, please. This chart depicts the number of days from initial application to approval. And again, the licensing unit within this board handles those operations. The average number of days from initial application receipt to approval, based on data we looked at, was 96 days. It's important to note that this board is paper-based in terms of initial applications, so folks are mailing in their applications as well as their form of payment. So it's not online payments, it's not on an online application for initial applications. However, for renewals, there is a web-based system, so they can renew online and they can pay their fees online for renewals. Next slide, please. All right, as mentioned earlier, so this does depict the complaints against practitioners. As you can see, the board received around 100 to 200 complaints per year, and the complaints have doubled over the past 5 years. And in 2021, the board switched from a paper-based where people had to mail in their complaints to a web-based system called EMS, the Enforcement Management System. And so that 367 that you see there in the orange bar, clear spike there, was when they took the paper-based systems and input them into the EMS system. So that took care of that spike. But you can see, each year there's an increase in complaints, and that's not necessarily bad. It kind of correlates to the increase in credentials. This board, again, manages 13,000 credentials that we looked at in 2024, and that number continues to increase. Next slide. All right, funding. So this board is specially funded from credential fees, as has been discussed earlier. The fees for this board are reasonably priced. We did look at fees compared to this board to other states, and this board fees are 100 to 200 depending on a credential. However, you can see that this board does have revenue and surplus on a year-to-year basis, but there are some constraints as they need approval from MDH and DBM in terms of what they want to do in terms of staffing, information technology improvements, things of that nature. Next slide, please. All right, so this board is quasi-independent. I know there's been a lot of discussion about the role of MDH and the boards. We did take a short look at that in this evaluation. The items on the left are the type of decisions that come to the board, and on the right is the level of autonomy. So, when it comes to, in terms of credentialing and determining who's going to receive a license or certification, the board, that's independent. Board has that authority. However, when it comes to decisions in terms of, IT systems, staffing, this board is more reliant on MDH. Next slide, please. And just kind of wrapping up board status, this is as of July 2025. I will say, and the board will probably talk about it, there have been some improvements made, but at the time of our evaluation, there were 3 vacant seats and 4 seats that had been expired. And in August and September, unfortunately, the board was not able to meet quorum due to the board seat vacancy, and so they weren't able to meet. And then the appointments are not subject to the consent of the Senate, so they're not included in the greenback process, and more to follow on that with one of our recommendations. Next slide. All right, during our evaluation, just to wrap up a summary of the next two slides, we provided 7 recommendations that are listed here. The first one addresses that the slide we just saw addresses the board seat vacancy. So we're recommending that this board appointment, subject to advice and consent of the Senate, make it part of the greenback process. And then the second one, programs for new executive directors and orientation, training, and mentorship will hopefully help new executive directors as well as current executive directors. The third recommendation, hiring of a dedicated human resource staff that's shared amongst the 16 smaller boards. Just as you saw in the organizational chart slide, there are already some shared staff with IT and finance, and so adding shared staff for HR would definitely help out this board. And then converting contractual positions to merit positions. Again, this board has difficulty filling and retaining contractual, and it really impacts the work of the board and their ability to decrease the backlog. Next slide, please. And lastly, to finish it out, the last 3 recommendations, we talked about the IQ service records, and again, I think it'd be beneficial if the board members saw this information that's coming from constituents to give them a sense and idea of things that are going on in the board. And in our analysis, we saw that a number of applications were delayed due to missing information. Taking measures to reduce the number of applications with missing components can definitely help the backlog issue. And then lastly, again, the system's paper-based, but having a tracking system for this board to track the applications where they can better address backlog, workload, and accountability issues of the application processing. Subject to your questions, that concludes our brief.
Yeah, thank you for having us here. And I also wanted to thank the Board of Professional Counselors and Therapists. The board chair is here, the executive director is here, and the deputy director is here. And I will just say that when I reached out to them back in the late winter, early spring, I got in touch with the deputy director. At that time, she had been there for about 2 weeks, and the executive director was about to start the week after that. And so it wasn't great timing for probably us or them, but we really appreciate their cooperation as we've done this work. And with that, we're happy to take any questions.
Any questions? All right, thank you very much. We appreciate the presentation.
I was going to say, and Corey, I know this is your first time before the committee. Welcome, and thank you. Thank you for your service. We're glad to have you. I think we have some representatives from the board here. If they want to come down and present, or they're just here for questions. I will update. I know we have the testimony, so I guess just maybe here for questions in the interest of time. I did have one after you get a chance to get seated. So I guess my question, I think there's a lot in here that was really helpful. I think not only that's relevant to your board in particular, but I think how the committee and members of the General Assembly are thinking about sort of the relationship between a lot of the boards and the Department of Health and some efficiencies. The one thing that really stuck out to me, at least in terms of things that we could fix in the near term, is the hiring and the vacancies. So I was wondering if you could tell me, what is your current vacancy rate, and are you all subject to the statewide hiring freeze, or because you're quasi-independent, though still dependent on MDH and DBM, can you maybe just walk me through where that is right now?
Good morning, Chair and Vice Chair. My name is Tomilo Bolani Kodri. I'm the Executive Director of the board. So to your question, we are also affected by the hiring freeze, and a lot of our positions contractual positions, and that affects both our ability to hire people in terms of getting people interested in those positions at all, and also staff retention, because one of the problems that we found was that a lot of the contract position staff that we have, sometimes it takes up to 3 to 4 months to train them, and by the time they're properly trained for the position, when they find merit positions elsewhere, they leave. This contributes to us being understaffed, and also now with the hiring freeze, we are unable to even bring in people as much as we want. But we're currently working with HR for the possibility of bringing in 2 new people, because we're able to submit the request to recruit in time before the hiring freeze. So HR is talking about an exemption that we can work with to be able to bring in those people. But that's the state of things right now.
What's the current vacancy rate for your agency?
Okay, so currently we have about 6 positions, but about 4 of them are contract positions. The 2 that are merit positions just became vacant because we had 1 staff member retire and another one relocated out of state.
Okay, so you're basically, other than the contractual positions, prior to the current loss, you were fully staffed?
No, we were not fully staffed. We had vacancies.
So what was the overall I guess that's my question. What was the overall vacancy rate?
Okay, so as of the time I joined the board in February, we had about 8 or 9 positions vacant, and then we were able to bring in 3 new people, the contract positions. And soon after that, there was the hiring freeze, and then 2 other people left.
What's that as a percentage of, do you know?
Almost about 40%, because for instance, in our compliance unit, we're supposed to be able to have about 4 investigators. We have just 2. And in the licensing unit too, we're supposed to be able to have about 7 licensing coordinators, but we currently have 4.
So I know we don't have anybody from MDH up on this panel, but I guess my question is, obviously the hiring freeze is in and of itself its own issue, but at a time where, I mean, I represent a lot of former federal employees in my district, and I hear, I mean, even within just the last week, I've probably run into 4 or 5 people who are looking for work, who are highly qualified. Can you walk me through what the holdup prior to the hiring freeze, again, which is a separate issue, what was the holdup in filling these positions, and where is the backlog coming from?
When I joined, just like the evaluation report showed, there was a little bit of turnover in executive directors. Some of them didn't stay long enough to be able to put in complete the process of hiring somebody or filling those positions. And I tell you, the process for filling each of those positions is usually very long. Multiple requests submitted, a longer process, because we are sharing the same IT team with a lot of other boards. So sometimes it takes a lot of time to even get a response or be able to push things forward.
And when you say request to MDH?
To HR.
Within MDH?
And then it also goes through MDH and DBM and about 3 other agencies to get the approval to be able to hire people into positions. So that in itself, in addition to the fact that there was turnover of executive directors, the lack of consistency in that position that can hire people, I think contributed to the backlogs.
Okay. Yeah, I think in terms of, again, the hiring freeze is an issue in and of itself, but I think mapping out and streamlining that process, especially at a time where we have so many people in our state who are who want to continue their public service, we should be able to fill these expeditiously. Thank you.
Thank you.
Can I respond? I apologize for my voice. I got laryngitis. Being on the board as long as I've been on the board, 7 years now, and having to go through a rendition of hiring executive directors and being a part of the hiring of the vacancies in board staff, that HR process through MDH is an arduous task. I mean, there's so many. It's an arduous task. It's time consuming. It's so many steps that we have to go through. We have to get approval. We have to wait on emails. We send emails. They send us the applications. We have different systems. We got to put information in. I mean, it takes a lot. And I mean, and me being a volunteer as the chair, just doing it, it was like a day's work just to even get it put in, to even consider hiring someone. And thankfully, throughout these years, we were able to convert one of our positions that it even took a year to convert it to be able to hire a deputy director. Because we wanted, with the board, we wanted to have some consistency. Because the deputy director does not work at the whim of the board, where the executive director does. And so that took time. So it's just this process with not having our own kind of HR person that we share with other smaller boards. I think if we had that, this process wouldn't be so long and drawn out.
Thank you, Ms. Moore. I guess I do have a follow-up question, because I appreciate you saying that. From your experience, both on the board and then as a practitioner yourself and being out in the field, do you feel like if we could solve these HR problems, we would have more practitioners, it would make your colleagues' lives infinitely easier?
Oh my, yes.
Okay.
Yes. Because as a practitioner, when I even applied for my license, it was just getting somebody to answer the phone. I have questions. Can you answer the phone? And so as a practitioner, when I was working to get my license, I kept getting passed around because this person wasn't there anymore. And so I felt it as a practitioner and then saw it when I became a member of the board.
Thank you.
Senator Lamb?
Yeah, thank you. I wanted to kind of follow up on Chair Solomon's kind of point here. So, I guess, and this is a question that I asked of the department earlier too, the board brings in money that's special funded through licensing fees, and then you have to get the department's approval to be able to spend this money. It sounds like there's been a lot of challenges in getting approval to be able to spend money that the board has brought in through licensing fees, which is causing a backlog because you can't get them approved and you can't get new positions approved. It just seems like a really roundabout way of doing this, that you have to pay the applicants have to pay these fees. They come into the board can't spend it. And then, as I referenced earlier, I think oftentimes the legislature and the governor might pull some of those funds out as part of the BRFA, because there's they might say the fact that this funding is sitting here, it's not being used, right? So it's this kind of catch-22, continuous feedback loop where, you bring in the money, you need the resources, you have the money, you can't get approval. People look at you're just sitting on money, they take it away from you. Like, how do we fix this broken system?
That was helpful. I don't know if anybody else can answer, but one thing that was helpful was when the MDH, when the secretary had a liaison, that it used to be Kim Link, that worked within the secretary's office, that liaison with the boards. And so that was helpful, but that position, Ms. Link left some time ago, and I don't know that position has been filled. So that was one thing that was helpful, that way we could go to Ms. Lincoln, we could say, help us talk to the secretary so we could get our own IT system for applications. And the other board, the physical therapy board, already spoke of, we have the funds to have our own IT so that these applications aren't paper any longer. But we kept getting put on pause, as was already spoken, that we couldn't do anything. So our money sat there. The money sat there, and it appeared to be available that we didn't need it, but we did if we could have spent it.
Right. Yeah, I had interacted with Ms. Link quite a bit before, and I know she was kind of the liaison there. Maybe they couldn't hire her position. That was a joke, but in the freeze. But I think she actually left before the freeze took place.
Yes, she did.
But, and this is back to the department, I know the deputy secretary is no longer here, but if they can get back to us on the process for allowing these boards to be able to use money that they've brought in through licensing fees, because this seems like just a feedback loop that goes nowhere, and we're not able to actually address this. and then the money gets pulled in that way. So, other question, you referenced the fact that I guess one of the recommendations is for the board members to be to come through the Senate for advising confirmation, advising consent. Obviously, as the chair of exec noms, I think that makes a lot of sense. Would certainly support that. But can you speak to why this process of appointing board members has taken so long, particularly since we're facing a behavioral health workforce shortage, just to get these members appointed and seated on the board? Why is this process taking so long?
I would have to say your guess is as good as mine. I have sent, when we started this process and we had board members, because we had one to get sick, and it took us 2 years to get him administratively removed from the board so that his vacancy could be open. We had one resign, and she sent it to the appointments office, her email of resigning a couple of times, and she resigned in 2023. So a lot of the question is hard for us to answer because the appointments office has to answer that question. Because I have strings of emails. I've been the chair. They kept electing me, I don't know why, but I've been the chair since 2023, and I've sent a string of emails since 2023, please, we need board members, and crickets. Either no response or we're working on it.
So it's taken you years to be able to get new board members appointed to this board?
2023. And we just got some recently, and 2, 3, 4. We got 4. And so we were able to have quorum and have a board meeting last week. So I'm so excited about that. But yes, sir.
So 2023, this is almost, we're almost in 2026.
Yes.
This was basically extending back to the beginning of this current administration. We've had these vacancies just sit and sit and sit with no appointments. Which is very frustrating. And I share that frustration. Is the process here that recommendations may be put forward to, because there's several levels of appointments that this goes through. I think there's actually an appointments office at MDH that reviews some of this, and then it goes to the governor's appointments office after that. Do you know where this is getting hung up? What's taking so long? I'm guessing that since you have some frustration with this, that you're sending your names and recommendations as quickly as you can, but it's getting hung up somewhere above.
It's the governor's appointments office, because Michelle Money Red, she in the MDH office, she has been helping, and she was like, okay, give me your selections, who you want to nominate by November. I'm just going back, November 2024. Maybe we can get the secretary to review them before the legislation so we can get these appointed. Did it. Gathered the list, did it. Crickets. Nothing happened. Then the legislation came in, legislative started in April of 2025. Again, send us the names. I sent you names in November. Sent the same names. Crickets. And again, we just finally got 4 new board members. So it's the appointments office, the governor's appointments office that, in my opinion, based on the emails, has been the holdup.
Okay, that's helpful. We've heard about a lot of held up appointments, not necessarily because of certain particular reasons or themes, but I will speak with the secretary about making sure that we get appointments in a timely fashion. On applications, I know that you had made the recommendation to allow the board to have online application submissions. Has the board wanted to do this and not gotten approval from MDH or from Do It? And what's the status of that?
MDH pause. We have asked, we were like, we got the money, can we do it? Can we do it? And then we were put on pause for the Department of Nursing to get an IT system, and we all be a part of that. And we, if we don't have anyone to advocate for us with MDH, so we can move forward without waiting on.
How long have you been paused?
It's been paused since, it's been a couple of years. It's been a couple of years.
So prior secretary gone, now under the current administration still on pause. There's another instance of MDH just on permanent hold.
Yes, sir.
No response, no update. Okay. Last question here. I'm told that by several substance use treatment providers that they've had some difficulty getting their alcohol and drug trainees approved for a higher level of credential. And I think your report showed that there were a few trainees that were able to move up in levels, but not specifically why that was the case. Did you hear in your interviews like why that, what those reasons were?
Hello, and my name is Victoria Stinson. I'm the Deputy Director. I do oversee some of the compliance issues. I think what it is that it could be a barrier as far as mentorship and training in that particular. Also, it could be portions of a background investigation that possibly takes a little longer, and I think that's probably the root cause of it.
Okay. And just one final follow-up. Wasn't there a work group of the board that was meant to look at overhauling the alcohol and drug counseling levels? What happened to the efforts of that work group?
I cannot answer on that. That may have been prior to my employment at the board.
I can't answer that. We did put together alcohol and drug subcommittee to work on the regulations for the ADTs. But again, due to not having enough board members, those meetings could not continue to happen. The individuals appointed to that committee were board members that have now resigned or their term ended. So that alcohol and drug subcommittee to get the regulations updated and in place has been sitting stagnant, waiting on new board members.
Go ahead.
If I would add to the reasons some of those cases happened with the ADT applications, for some reason, a lot of those applications have issues with background checks. So when we receive those applications, while processing, during the background checks, if anything comes up, it has to go through compliance. And when it gets to compliance, because compliance too has a lot of backlogs that you're dealing with, and then with the way the regulation is, even cases that are maybe trivial in some instances, the compliance unit cannot just make independent decisions by themselves. The board has to sit in some instances to make decisions about whether to approve licensing or deny licensing. So it's like a process that connects with each other. Then, without quorum, the board cannot sit. The board cannot make decisions. So this is the unique situation about that particular license type that makes, in some instances, so at the end of the day, when the board is able to sit, it might end up in a denial, an appeal, maybe a hearing and things like that. So it kind of delays the process a bit. But majority of the issues we face is the fact that, well, until now, when the board cannot sit and make decisions on those cases, it just sits there.
So the board can't sit because you don't have a quorum?
Yes.
Which is really incredibly frustrating. I mean, for the dysfunction that we're seeing, we don't need a whole report to tell us that a board that doesn't have a quorum can't function. Mm-hmm. And if this is being held up either, you know, at the department or at the appointments office, it really is unacceptable in many ways. That you have to be able to function as a board to have a quorum to be able to do so. There's no reason that appointments should be held up for years before they come down and you can seat members to be able to actually do business of the board. And whether it's the appointments or getting approval for funding that you need, you know, I think even in this hearing, it's been incredibly disappointing to see the inability of the department to be able to answer some basic questions, even questions that I asked earlier. I think we were 0 for 3 in getting any answers on. You know, I can see why you're just as frustrated too. And it's a partnership, it's a collaboration to be able to have you do your job, but you also are dependent on MDH to be able to do theirs. And it seems like this process is falling short. So thank you.
Thank you, Senator. One follow-up question. Is the delay on criminal background checks, is that a state issue or a federal government issue?
So there's no delay with the background check, but after the background check, the board has to see to decide.
It's the board, okay. I thought I heard you say that there was also a problem with the background check. No. Okay, thank you. Delegate Ahrens?
I guess I'm not sure whether my comments are meant for us or them, but it seems to me, I wonder what we've accomplished today other than to find out that we have several different boards with similar problems, and they're going to continue regardless of what we said we're going to do on paper because of the problems that are inherent to what you're doing as a board. And I'm wondering who is in charge of this and who can actually put this together and say, we're actually going to resolve some issues here because you all have same problems up and down the line. Yet you all have everybody, different groups to report to, and nobody's coordinating these efforts. We're wasting a tremendous amount of taxpayer money. We're not servicing a tremendous amount of our constituents by doing this. And I'm wondering if we as a committee can help with that, or does MDH have to come in and sit down and say, you know what, we're all going to grow up, we're going to put an organization together that's going to function and take the onus off of you to sit back and say how tough it is to get board members and put somebody in charge of everything that's going to get results. I don't see that happening today. It's been great talking to you all. It's been great hearing all the things we're going to do, but we've not solved a problem today. And I was wondering if there's something we do, Chairman, or if it's something we ask the Department of Health to do.
I was going to say, Delegate Ahrens, I think you've just volunteered yourself to be part of a work group that we may be,
maybe
working on.
I will promise you I will commit my life to it. I've been on this committee forever, and this would be a great step to actually get something done that I can sit back and say we fixed something.
I was going to say, I think, not seeing any more questions from the committee members, I think we do have a good roadmap here. I think, among many of the members here with their shared expertise of things that we can do legislatively initially. I think this coming session, I think some of the more complicated topics that we've come upon probably will require, more data that we need back from the Department of Health to understand. I will just say, I still don't know that I know exactly which board has which requirements, which board is using a shared service, which board has their own service. I think some of my colleagues would share that. So maybe I'll put this out there. MDH, you will probably be getting something from us shortly, requesting a very clear breakdown of what each board has, does not have, where things lie. And then I think there will be a lot of interest in collaborating with the administration, with the boards to figure out whether there is legislation that's required to change some of these processes for the better. So really appreciate you all being here. And again, appreciate OPEGA and the work that they did to put this together.
We did too. Thank you.
Thank you very much.
Thank you very much. There are a number of issues that have been brought up today that are very consistent across, and we hear the messages. We will follow up, and we are going to adjourn at the moment. Thank you. Go ahead.
I did just want to say one other thing. We did have cybersecurity findings as well. Want to thank the audit team and OLA for those. In the interest of time, we are not going to go through those. I think we've had a robust conversation about IT, but to the members of the committee, you obviously have the confidential report, and certainly, we're going to be working on those as well. So wanted to just make sure that we acknowledge that and thank OLA again for their work on those.
We will see you back here next week.
We are going to be in appropriations.